Okay, everyone, I think it looks like we have a quorum here and it's a couple minutes after the hour. We have a packed agenda today, so we will go ahead and get started. My name is Kristen McGovern. I'm a partner here at Serona Strategies. Thank you for joining us today for the 5th version of our Health IT Leadership Roundtable, maintaining consumer trust in healthcare through data privacy and secure patient access to health information. This is certainly a robust and timely policy topic, with recent action coming from Congress, coming from the administration, and also a lot of action in the private sector. We're pleased to have an esteemed group of speakers here today, including administration officials, members of Congress, representatives from some of the most preeminent organizations here in DC, and also private sector leaders on privacy from across the country. Before I introduce our first speaker, Gary Anderson, for opening remarks, I wanted to share a brief overview of the Health IT Leadership Roundtable Initiative, preview the agenda, and address a few housekeeping issues. So the purpose of the Health IT Leadership Roundtable Initiative, and this will be a repeat for some of you who have joined us for our other events, but the purpose of the initiative is to bring organizations together with a variety of different perspectives to talk about our shared commitment and roadmap on important health IT policy issues of the day. Today's topic, as I mentioned, happens to be data privacy and secure patient access to health information. Previous topics that we have discussed include public health, health equity, and the future of health IT with AI and machine learning and other topics along those lines. Today's event is brought to you in partnership with a host committee of organizations from across the healthcare system, representing patients, clinicians, hospitals, health plans, and technology companies. You can see them here on the screen. We are so thankful for their participation and their support and the lead up to the event, and also the work that they continue to do even outside of the events and helping contribute to the thought leadership of the Health IT Leadership Roundtable. Now let's take a look at the agenda really quickly so that you know what to expect. So in just a moment here, I'll turn it over to Gary to provide opening remarks. We'll then have an administration keynote with Director Fontes Rayner from HHS Office of Civil Rights. We have a couple panels then following, one on maintaining health data privacy and patient access, and then another one later in the morning on protecting non-HIPAA covered data. In between those panels, we have remarks from a legal expert on the state perspective, and then we also have congressional remarks from Senators Klobuchar, Senator Wicker, and Representative Sarah Jacobs from the House of Representatives. So we are so pleased again to have all of our speakers participate today. We will try to take Q&A where we can. It is a packed agenda, but if you have a question, please do put it in the chat. We will answer either live if possible or after the event if we aren't able to get to all of the questions. As far as housekeeping goes, we'll also be tweeting about the event from our Twitter handle, which you can see here on the page. We also have a new LinkedIn page. You can follow us there for content and further discussion. Please feel free to tweet at us and with us and to engage with us on our other social media channels. We are recording today's event, and we will make the recording available on the event landing page as soon as possible. The event page is on the Serona Strategies website, which you can see the short link there on the screen. Some materials and the recording will be posted there. Finally, I did want to note we do have some members of the press joining us today. If you're a member of the press and have any follow-up questions for the panelists, please reach out to Melissa Quick at the email listed below. So now turning to the topic of the day, now that the housekeeping and sort of level setting is out of the way, healthcare data privacy is at the heart of consumer trust in healthcare. Technology is increasingly being used in new and innovative ways to deliver care, and vast amounts of data are being aggregated, generated, and used across the healthcare system. Today, this roundtable will discuss the overall importance of maintaining consumers' trust and right to access and control access to their healthcare data, opportunities and challenges created by existing regulatory frameworks for both HIPAA-covered and non-HIPAA-covered health data, perceived gaps in data privacy and congressional and administration actions to address those gaps, And then finally, last but not least, recommendations for moving forward. Speakers and participants will bring unique perspectives to these issues, and I think we'll have a great conversation today as we tackle some really timely but also very difficult issues to unravel here. So at this point, I think with that sort of foundation in place, I'll go ahead and turn it over to Gary Anderson. Gary is the Senior Vice President and Chief Information Officer for Guidewell and Florida Blue. In this role, he's responsible for leading information technology functions, including infrastructure and architecture, information security, capability development and support, information management, and capability investment portfolio management. So just a few things there in Gary's purview. So Gary, thank you for joining us today, and I will go ahead and turn it over to you.
Sure, and thank you very much, Kristen. And this is great to be part of this. One of the things that Kristen kind of highlighted as we talked about here is just the health data and the privacy aspect of all this. And health data and privacy is top of mind and critical in healthcare for many reasons. In recent years, there's been data privacy and consumer trust issues that have come up. And a lot of consumers have really started to say, wow, there's less and less things that I can trust that my data will be safe and maintained in a safe and secure fashion. So we've really looked at the different HIPAA privacy laws. All of you here have been involved with that, and various regulations that really make it clear what is protected and how do we make sure that we do that. However, in this digital age, healthcare data, privacy information around that is increasingly growing in different areas. So there's a lot of different apps that store this information for consumers as well. Some of those things that are getting stored are kind of outside the scope of HIPAA, but they still are considered to the consumer their health data, and they expect privacy around that. So different changes and advancements in this space, the knowledge of consumers are really growing in this. And there's various rights that they have associated to HIPAA, and also just how much they have in confidence that that data is going to remain secure. All of you know the different things that have happened in the healthcare area with respect to different breaches that have happened, and those are all things that weigh in consumers' minds and thoughts when they consider sharing or having their health information with a particular provider or payer. And different things aspect around this. So different privacy pieces or different surveys that have happened, look at that. And, you know, there's been a lot of response to patients around this. So different surveys have gone out, and they believe, consumers overwhelmingly believe that privacy and the rights of their health data should not be available for purchase. And again, different things that happen around that with respect to HIPAA and payers are very well managed, but other pieces of information that are managed through these consumer portals or consumer applications may or may not be so secure. And there's a lot of things when you click agree to that consumers may see that and have a bad experience around that. And they may not distinguish between, well, that was something that was covered by HIPAA and my payer or this health plan, and they may view that as being something that's still encompassing in all of that data. So every aspect of this has really got to be focused on. We really need to make greater transparency for how we get this trust, how we make sure that we restore trust for the consumers in this space, and also achieve overall advancement in what we can do with this healthcare information and making sure that we improve the quality of life and the experience for the consumers. You know, when we look at this kind of panel and the agenda that Kristen laid out today, we look at this as having a great opportunity here to have a dialogue and exchange, bring up many unique perspectives across this field and different discussions around what do we do now with digital and all of these different avenues that have available for consumer and their personal health information, and how do we make meaningful strides in this area while restoring the consumer's trust. So anyway, I think that's really a great overall background perspective. I know in my experience and working in this space, I've seen that regulations come in and change with HIPAA. And I've also seen a large scope of what is considered personal health data and how that's treated in the overall market. And then seeing the things in the press that happen around breaches, all of those things really cause a lot of us to really think about how do we make sure that the consumers, the personal health data, and all of that maintain in a very safe and secure fashion while still promoting the quality of life aspect of this. So anyway, I'm going to turn it back over to Kristen here, and this ought to be a wonderful program. And so thank you very much.
Thanks, Gary, and thanks for bearing with us as we make the transitions here between speakers. So I think those remarks sort of set the stage for our discussion today. As mentioned in my remarks and in Gary's remarks, this is a really complex and multifaceted issue with a lot of competing priorities and principles to be balanced. On the one hand, desire for patients to have access to all of their information in a secure and timely and convenient way. On the other hand, wanting to make sure that patients make informed decisions and have the resources needed to make those decisions as we think about sort of the new frontier where people are increasingly accessing their information in new and different ways. So with that, I think we will turn now to the Director of the Office of Civil Rights at the Department of Health and Human Services, Melanie Fontes Rayner. And you see her information there on the screen. Director Fontes Rayner leads the department's enforcement of federal civil rights and privacy laws and directs related policy and strategic initiatives. Previously, she served as counselor to HHS Secretary Javier Becerra, providing strategy guidance to the Secretary on issues pertaining to civil rights, patient privacy, reproductive health, and the Affordable Care Act, as well as competition in healthcare, equity, and the private insurance market. Melanie has a law degree from the University of Arizona and other higher educational degrees as well from a number of other academic institutions. So we are pleased to have her here today. I think if you will bear with us again as we bring up some slides and transition the video to over to Director Fontes Rayner. I did want to say, recognizing we do have some members of the press on the phone, the director's remarks are off the record unless she says otherwise. So please treat the message as we move into her section of the presentation. Oh, let's see. We are running a few minutes ahead of schedule, and so we may be waiting here. Okay, so I think we might be waiting, given that we are ahead of schedule, we might be waiting a few moments for Director Fontes Rayner. I did want to just take this opportunity to talk a little bit about the policy landscape. Even just last night, we saw CMS release an interoperability rule that includes a number of considerations for patient privacy and sort of thinking about how health plans in particular go to apps. Wait a second, Director Fontes Rayner, are you there now?
Hi, Kristen, this is Michael Huggins. We are, I think she has not, I think she is running, she's at a meeting right now, but as soon as she gets on, I'll alert you.
I will keep recapping sort of where we are in the policy landscape.
Okay, sounds good.
So as I mentioned just last night, the Center for Medicare and Medicaid Services released a proposed rule with a number of implications for apps and how health plans, or how the administration believes health plans should be required to share information with patients. I think we've also saw just last week, and I believe Director Fontes Rainier will discuss this, that the Office of Civil Rights released guidance around tracking technologies, Google and Metapixel. We also know that the administration is working on a number of proposed rules that will have implications for individual access. So one coming from the HHS Office of the National Coordinator for Health IT any day now, which will be a follow-up to its previous rule around 21st century cures and certified technology that makes information available to patients, as well as the information blocking structure. The Office of Civil Rights here is also working on a final rule related to the HIPAA and PRM. So certainly no shortage of activity, even as we think about all of the moving pieces with respect to this issue, and especially in light of the recent decision on Dobbs. We also, and I think we have Melanie with us now, so I'll turn to her in just a moment. I did want to say, just as I sort of wrap up my landscape assessment here, is even as we have a number of really significant actions either already completed by HHS or anticipated by HHS, we also have significant action this Congress from our leaders over on the Hill in the form of a number of bills to protect reproductive health information, but also comprehensive data privacy bill, the America Data Privacy and Protection Act, which has not been voted on yet, but has made it farther than it's ever made it before. So a lot of developments here, I think, as we all collectively grapple with sort of the emerging world of data in general, but also health data in particular. So with that landscape in mind, since I believe she's here now, and we're back on track with our timing and our agenda, I will go ahead and turn it over to Director Fontes Rainier to provide remarks. Again, as I mentioned earlier, her remarks are off the record for those of you from the press who are here, unless you hear otherwise from her directly. So thank you in advance, and thank you, Director Fontes Rainier, for being here today.
Yeah, thanks so much. Is someone pulling up the slides? There you go. Thank you. So I'm delighted to join you all here today to talk about privacy and security of protected health information. I think you all know the Office for Civil Rights plays an important role here, and we are committed to supporting the healthcare industry and working with the healthcare industry to protect the privacy and security of confidential data. Next slide. So just a couple of things to sort of cover today on topic. Later on today, it was supposed to have already happened by now, but it hasn't. OCR, along with our partners at the FTC, ONC, and FDA, will release an updated online tool that's interactive to help industry members determine what federal laws and regulations apply to their applications. Anyone involved in any health app marketplace, this includes HIPAA-regulated entities, providing web-based tools to their patients to check out this new compliance resource. A quick look at the updated interactive tool demonstrates that it's meant to be a sort of easy process to help covered entities or non-covered entities. Just to answer a few high-level questions about the nature of your app, how it functions, the data it collects, the services it provides to users, and then, once you're on the interactive app, it'll point you to federal laws that might apply to your product. So for example, your app is covered by HIPAA, the FTC's Health Breach Notification Rule, the Children's Online Privacy Protection Act, the 21st Century Cures Act, ONC information blocking regulations, the Federal Food, Drug, and Cosmetic Act, etc. To be clear, the interactive tool can't subsidize for personalized advice, but it can give app developers a good head start in compliance and what laws should be consulted in their creation. So this is up later on today. We will, Rachel Seeger from my office will share it with folks here to make sure folks have it. But we're excited at the timing of this conversation so that we can, preview it for you and highlight it for you. Next slide. You all saw too, last week, we issued a bulletin highlighting the requirements of HIPAA regulated entities when using online tracking technologies to protect the privacy and security of health information. Online tracking technologies like Google Analytics or Meta Pixel collect and analyze information about how users interact with their regulated entities, websites, or mobile applications. The HIPAA rules apply when the information that the regulated entities collect through the tracking technologies or disclose the tracking technology vendors includes electronic protected health information. This information can include an IP address, medical record number, home or email address, dates of appointments, or other identifying information that an individual may provide when interacting with the web page. Some regulated entities regularly share EPHI with online tracking technology vendors and maybe doing so in a manner that violates HIPAA. I know we've seen a lot of this. The bulletin helps explain what tracking technologies are, how they are used, what steps regulated entities must take to protect PHI when using tracking technologies to comply with HIPAA. Specifically, the bulletin itself provides examples and insight on tracking on web pages, tracking on mobile applications, HIPAA compliance obligations. The bulletin also reminds covered entities they are not permitted to use tracking technologies in a manner that would result in impermissible disclosure of PHI to tracking technology vendors or other violations of the HIPAA rules. It also answers questions for those using tracking technologies, importantly, in how to protect the privacy and security of health information they hold. We recognize that this data may provide valuable insights, but HIPAA regulated entities, including technology platforms and clearinghouses, must follow the law, and making sure that patients' health information is at front of mind when using such tracking technologies. Next slide. I think we talked about this last time I was with the bigger group, but we also put out information related to protecting your privacy and security when using a personal cell phone or a tablet. Again, I think a lot of folks think HIPAA covers everything on your phone. And I know this group is savvy enough to know that's not the case. When the Dobbs decision came out, OCR issued a number of guidances in response to some inquiries we were getting, both from covered entities and outside. And so this guidance was meant to help provide a tool for folks to use. We started with period trackers because there was a lot of folks talking about how period trackers can be used to track, but really it's beyond that. I don't know about this group, but I pretty much do everything on my phone now: doctor's appointments, social media, shopping, you name it. And so making sure that in this sort of new era that the sort of due diligence to protect your privacy, you're taking those aggressive steps, making sure that like geolocation data can't be misused to track you or to seek the kind of healthcare you're receiving. So the guidance itself explained, again, that HIPAA doesn't protect a lot of things on your phone. It also explained how to do things like turn off the location services, identify best practices for selecting applications, taking steps to use encrypted end-to-end encryptions. Again, we want to make sure that when you're using healthcare on your phone or elsewhere, that you're not using it in a way that makes you targeted for discrimination or targeted for your healthcare data to be used elsewhere or in other data. So again, this is an important step, one we think it's important to remind folks of. Next slide. So I think we've talked about this a little bit too. HHS has continued an right of access initiative. This is a commitment that OCR has made to increase and underscore the importance of this. Individuals may have a right to timely access to their health records and at a reasonable cost-based process. The initiative began in February 2019. To date, we've announced 39 settlements and 2 cases resolved with civil monetary penalties. We announced 11 actions in July and 3 more in September. investigations are ongoing around the country, and we're continuing to work on this robust enforcement. And then last slide. These are just some tools to interact with OCR, our HIPAA website, our privacy and security listservs folks can sign up for, our complaint portal, our email address, our phone number, and where to follow us on Twitter. Making sure that individuals have access to protected health information, making sure that OCR is doing, its obligations to ensure privacy and security of data. OCR is watching trends around the country to make sure that we're diligent in understanding the sort of trends we're seeing on breach and security. We're proud to have a seat at the table here today with you, and that our ongoing support to work with the industry here is important. And we look forward to that continued partnership. So I think that's it for me.
Great. Thank you so much. Do you have time for a few questions?
Yep.
So I wanted to ask, just as a first question here, what processes the administration has in place to understand the new privacy threat landscape? So as new technologies emerge, how are you thinking about new threats to patient privacy?
Yeah, I mean, so I think that's sort of a twofold, right? So I think OCR has always had, we have a division, we have a team that thinks about this both on the enforcement end and policy end. I think you all know that guidances, FAQs, things on our website oftentimes come from trends we're seeing, right? Web tracking, that was from us monitoring and seeing trends around the country, and just happened to be timely that those things were popping up again. I think that's a really important way in which we monitor that, but our team is also doing that, and like we're doing engagement, right? So I'm in the process of going around the country and going to our regional offices and trying to be in the field more and engaging at a stakeholder level on the ground. And I think through those processes, we get questions, we get incoming, and that's one way in which we monitor these things. I think the other is, OCR is just a part of the pie, right? We work together with our other US government colleagues. So here at the department, that is, working with the Office of National Coordinator, that's working with, the OPTIVs like Centers for Medicare and Medicaid Services and others, that's working with the FDA. And we do, we sit on several working groups, we sit on several sort of cross-cutting initiatives we're working together, as well as with our colleagues, at the White House and FTC and other places. And our staff just regularly has interactions to do that, because I think, like the announcement that will come out later today is a good example of that, right? We worked on that together. We thought that there was value to releasing it together, given the sort of nexus of covered entities.
And so when you're out in the field, what types of stakeholders are you working with or talking to? Is it community-based organizations, providers, I'm assuming technology professionals, security professionals, sort of all of the above?
Yes.
Yeah.
And I think, to the extent this group has recommendations, we are happy to, oh, okay, sorry, you went away and I thought I was all alone. Sorry. Yeah, no, I think if you all have recommendations, we're happy to pick them up. I think we are doing various roundtables and such, and convenings with cross-cutting groups of providers, advocates, community-based organizations and whatnot. And I think have a very strong openness to doing more.
And as you think about your partnership and engagement with other parts of the agency, I know you already talked about some of your other partners there at the Health and Human Services. What what types of things? So it seems like maybe if you're monitoring trends and you identify a trend and it's relevant to another agency, then you work with them on that. If there's a regulatory matter that you need to work on together, sometimes you put your heads together to come up with the best approach. Do you sort of how frequently and how often are you in coordination with your other agencies at HHS? I would imagine it's probably a daily sort of thing.
Yeah, I mean, it's very regular, right? I mean, I think I personally meet with, Mickey and ONC pretty regularly. Just my team meets with them, you're right, almost daily. And then I think as needed with other parts of HHS, but there is like a sub working group here that's working on things like cyber. There is like a sub thread here on privacy, and OCR has a seat at those tables, and we're sort of very continually working across those tables.
Great. That sounds, I think, one of the things that, these issues are so multi-layered and so complicated that change in one area, can impact a change in another area. And so it's great to hear that you have that kind of coordination. Can you speak a little bit, and I know you already did in your presentation, but can you speak a little bit about the recent bulletin that you put out last week on the tracking technology? So you mentioned that sort of came from trends that you saw out in the field and that you were monitoring. And, I guess one question would be, besides the risk of a HIPAA violation, what other risks are posed when information is disclosed to an entity or third party like a tracking technology? Or like a phone that uses a tracking technology, or any type of, device?
Yeah, I mean, I think we're seeing or hearing, right, of instances where that data is being used in whether it's a discriminatory way or not. But like, I think we've seen it in the substance use disorder space. I think certainly we anticipate it is a space in the reproductive health space where that data is being tracked. It's not being appropriately protected with the appropriate measures under, by the covered entity. And so, it is exposing the patient in a way that otherwise they wouldn't be. I also just think on that point, right, like the idea is we've seen trends in this space. We're putting out this bulletin. The hope is that the bulletin itself puts covered entities on notice so that they can take appropriate steps and deter possible disclosures of this data. But also, I think making sure too that folks, folks is the wrong word, people have visibility too.
And how do you think about, and actually I should pause to say, if anyone in the audience has questions, please feel free to put them in the chat. But while we're waiting on additional audience questions, I wanted to ask, how do you think about balancing the desire to, you mentioned that you do everything from your phone, just like many people. So how do you think about balancing the desire to want to modernize the privacy framework and make sure that it is reflective of new types of technologies and apps, and we're letting the technology innovation happen, but at the same time, we want to make sure, one, that patients have the education they need to make informed decisions, and two, that we're not going so far to the end of the spectrum that patient privacy is actually being eroded because these third parties and apps and whatnot, whatever they may be, are sort of getting access to information without patients really understanding what they're doing. So how do you think about balancing these competing tensions?
Yeah, I mean, I think there's not going to be one perfect solution, right? This is going to be an organic growing process, and whether policies at HHS need to change or elsewhere, like I think that is what policy is, right? It's not a stagnant thing that stays the same forever, and in part because we need to understand the way our covered entities are interacting with the regulations and how it affects, people. I think there's also, and I think part of that is guidances and FAQs, right? Those things are faster to get out than regs. And I think that those are ways in which we try as the regulating body to help provide that information. I think it's also incumbent on us to do as much outreach as possible, right? To make sure folks have visibility into this, right? You can put out a press release and that hits a lot of people. You can put out in a listserv, but thinking through other ways to, whether it's working with our counterparts here at HHS to specifically work with their covered entities, whether it's like at FQHC or, a provider through CMS, like thinking through those kinds of strategies to make sure we're casting as wide of a net of information as possible. I also think, right, like there is an onus here on companies to think about these things and to do the right things here. And so, it is not just a one-way street. This doesn't just happen with just HHS, right? Like it is certainly a partnership with industry. And I think industry taking some responsibility for the new landscape we're in to help protect that privacy.
Great. I think we do have a question here, and it relates to the tracking guidance. So I think it's pretty relevant to what we were just discussing, but the question is managing all BA tracking type onerous for healthcare systems? What responsibilities do vendors and companies have, or will they have? So I guess this is asking about, like, how do you draw the line between what a business associate in a covered entity does versus vendors that may not be a business associate? I guess that would fit to FTC's purview. So this is an area where you likely work with your other agency counterparts. So you track it and work on it up until the business associate relationship ends, and then after that it goes to FTC's jurisdiction.
I mean, I also do think too, right? Like this web tracking bulletin, we worked on it with the FTC. It goes to beyond just our covered entities and BAA folks, right? So like, I do think it also increases visibility outside of what we regulate, right? And I think that's the point. We're trying to be as transparent as possible so that we're getting people to do, to take these things into account.
Great. We do have one person has raised their hand here, so we will, I think, unmute her. And if you could identify yourself, name and organization, that would be helpful too. Thank you. Yolanda, are you ready? Yolanda. Nope. Okay. We have another question in the chat, so we will go ahead and go there. Are there ways for the FTC to align with HIPAA, as the FTC consumer privacy laws seem to have a different approach and framework? Does it require congressional action? We do have some staff from members of Congress on the phone here today, Melanie. So, if there's anything you want them to do for you.
Yeah, I'm sure my ledge folks will love that.
Yeah.
I think, there are ways in which we do currently work with the FTC, and like my team, my HIPAA team, like they work with the FTC all the time. And at a leadership level, we work with them all the time. Whether or not there needs to be, additional legislation to tweak some of these areas, or some of these areas where it's ambiguous, I don't know that I can express an opinion on that. But again, to the earlier point, I think technology is changing. We have places where we can adjust our policy to make sure we're being flexible and adaptable to what is happening. But I also think, at some point it requires a revisit to the underlying statutory framework to see if it still fits with where we are. And so I don't know that that's like an express opinion, but I do think there is value in thinking through these things. And I think certainly we coordinate very closely with the FTC, understanding that they're an independent agency.
Great. And last but not least, maybe, one of the key activities here. So we've talked a little bit about enforcement, and we've talked about, reg guidance and sub-regulatory guidance. Another key piece here is education. So it sounds like even later today, you'll be taking action on education by sort of releasing some sort of tool or guidance to help people understand more about, where HIPAA starts and stops in some cases. So there's a level of provider education that's necessary, and that you all have taken a number of steps to help educate providers. There's also a level of patient education that is needed to help make sure that people understand their rights. And if anyone has spent any time on Twitter, you have a nerdy health policy Twitter like me, you often see these tweets about, like, HIPAA says I can't do, I can't order a milkshake at McDonald's or whatever. And, that's obviously not the case. So, so how are you all thinking about your role in educating the different parts of the healthcare system, whether it be providers or individuals and patients and or even app developers, as they think about their responsibilities?
Yeah, I mean, I think, so one, I think OCR has an impossible task here, right? Like, and so that means that engaging with industry, engaging with covered entities, engaging with stakeholders, whether they're at a state or local level, they're at a national level, whether, it's like a advocacy organization or an association for particular practices or industry, right? Like, it is incumbent on us to do as much outreach as possible, right? Whether it's webinars or going to meetings like this, or, and my staff, is constantly doing briefings on the Hill. They're constantly, attending conventions and meetings across the country. So it is that, but it is more than that, right? I mean, we also at HHS, it's 80,000 people. And we have operating divisions here that cover really large swaths of the healthcare industry. So we are focused on working with some of our bigger colleagues here to make sure that we can provide those entities with information, and we can partner with them leveraging and using their resources to help with that. I think it is also making sure, we do a lot of this, right? But it's like we put up slides on our website, we put up YouTube videos on our website, and making sure we're disseminating those appropriately, again, to the right entities to make sure we have as broad of a reach as possible. So I think, we're doing a lot here. We can always do more, and we always want to do more. But I think, again, I'll put the call to this group. To the extent there are convenings you think we should be attending, to the extent there are particular industries you think we're not spending enough time with, like, communicate that to us. We will work on it.
Great. I think that's a perfect place to end. Thank you so much for joining us today and for your remarks. And, we look forward to further engagement and hearing more about OCR's work.
Thanks so much. Happy holidays.
Great. Thank you. Okay, thank you again to Director Fontes Rainier. We will move now into our first panel, maintaining health data privacy and patient access to their health information. We've got a little bit of, transitioning here to do as we bring up the other, the panelists for this session. You can see that all of them listed here. I will briefly introduce our moderator, Brooke McSwain, and then each of the panelists will go around and introduce themselves. I think maybe after Brooke provides a little bit of framing here. So Brooke is an experienced leader in telehealth development and e-health policy at the state and federal levels, focusing on connected health, privacy policy, and digital health practice and policy ethics. She has long been a passionate advocate for the safe, effective, and evidence-based integration of technology into healthcare service provision. She earned a degree, a bachelor's in science, from the University of South Carolina in exercise science and biometrics, and a master's of science from Northeastern University in clinical respiratory therapy and organizational communications, and a master's from Johns Hopkins in government and political communications. So we are so pleased to have Brooke, Mari, and Ashok here today for this panel. And Brooke, I will turn it over to you now.
All right, thank you so much. Good morning, everyone, and thank you for joining us today for what I am certain will be an absolutely enthralling conversation about how we can work to maintain consumer and patient trust in healthcare through our work in data privacy and by securing access to their health information. With us today, we have an amazing panel. We have Ashok Chenaru. He is the Chief Data Officer and Analytics Officer for Elevance Health. Graham Default, who is the Senior Director for Public Policy for ACT and the App Association, and Mari Savickas, who is the Vice President of Public Policy for the College of Healthcare Information Management Executives, better known as CHIME. That is much easier to say. Good morning to you all. Welcome. So before we get started, just a little bit of framing or background for everyone. In 2020, HHS proposed the first major updates to the HIPAA privacy rule in almost 20 years, seeking to update regulations to provide patients with easier access to their health information and to promote care coordination, among other provisions. HHS has not yet finalized its proposed rule, but has continued to take action to improve interoperability and exchange of health data and patient access to health information. The goal of our panel this morning is to explore the current role of the HIPAA privacy rule in protecting health data privacy. We will discuss the current gaps in the protection of health data between HIPAA and the FTC Act, the interplay with information blocking and interoperability, and the importance of education and maintaining consumer trust and control. Before we get started, I just want to say, if you have any questions, please put them in the chat. We will get to them at the end. And all right, let's jump in. So Mari, maybe we can start with you. Good morning, Mari.
Morning, everyone. Hi, Brooke.
Good morning. So a major goal of the privacy rule is to assure that individuals' health information is properly protected while allowing for the flow of health information needed to provide and promote high-quality healthcare and protect the public's health and well-being. How does HIPAA currently protect health data? And what are the current gaps in the protection of health data under HIPAA?
Thanks, Brooke. Let me start off with somewhat of a controversial, statement just to get people maybe a little riled up this morning. Shocker, Graham's already talking. HIPAA is far from perfect, right? It is certainly not perfect, but it has served our industry very well over the past, now we're in decades, makes me old, decades it's been around. But I would argue that the amount of data that is health data that is held outside of HIPAA covered entities is actually possibly even larger than the amount of data that is held by covered entities. And that is because of the proliferation of the internet connected things, medical devices, third-party apps, so on and so forth. So, I don't have a data point to say, I can prove this. It just seems like that's the direction we're heading. So, but let's answer your question. First of all, you asked me how is HIPAA currently work to protect data? First of all, it has restrictions, okay? Everyone who's a HIPAA person knows that you are a covered entity if you're a payer, a provider, or a clearinghouse. Those are the folks that process claims. Those are the only ones who can touch protected health information, unless, of course, you have a business associate agreement, right? So right there's some safeguards. There's like a wall around who can touch the data, when it can be shared, under what circumstances it can be sold, which is very limited. So again, let's just touch on a few of those points. So you can, doctors, for example, providers, they can share information without a patient's consent if it's for treatment, payment, and healthcare operations. Arguably, that O bucket is getting wider and wider, probably one of the imperfections. Okay, quality measurement would fall into that. I'm not saying quality measurement is bad, but that O bucket could be big. Now, sales, right? I mean, mergers and acquisitions, that's okay, right? You're buying up another provider, and I'm not an attorney, but there's some very limited areas where you can sell health information, but it's very restricted. So there are some safeguards around it. Now, what are some of the things that are maybe, where we're challenged? I would just say in terms of challenges, there's a few, and I'm sure I won't even have an exhaustive list, and I'll let my colleagues jump in, but de-identification. Okay, de-identification, there's 18 data elements that are allowed to be, that you must de-identify before you can share them, and in which case it then becomes outside of the walls of HIPAA, right? We're going outside, like name, address, zip code, things that would, be able to peg who you are. And so that's becoming ripe for challenges, right? I mean, if we have big tech and providers collaborating in the spirit of innovation, trying to bring medical advancements to patients, but you could easily, and there's a lot of evidence and many articles that suggest that, and people can point to, you can easily re-identify someone. It's not that hard. So I would say that's a shortfall that's not easily addressed, so even outside of HIPAA. And I'm sure Graham's going to touch on this when we get into some of what's going on in Congress. So that's an area. And I think also some other gaps around medical devices. Medical device manufacturers do not always easily go into a business associate agreement with a provider. They just don't. And so, but yeah, they're touching PHI. And there's a lot of devices out there. Let me just give you a few data points, and then I'll let my other colleagues jump in here. But in 2018, we did a study on the issues around medical devices, and we found that, on average, a facility has about 10,000. Can you imagine? I mean, let's just blow that out to how many thousands of medical devices there are, and with innovation, more coming on the market every day. That's just one provider. Many of them are not patchable. I mean, that's a whole other area that we'll get into, but let's just put that aside for a moment. And then we have, the third-party apps, right? Those are about 350,000, growing to 90,000. That's outside of HIPAA mostly, but sometimes you have challenges signing business associate agreements. So again, business associate agreements, de-identification, and then of course the last but not least I'd say, and I'm sure I haven't gotten it all, is as we move into the era of 21st century cures, there's confusion around when you share, when you not share. not everybody, unlike us, are HIPAA experts who like live and breathe by like the codified regulations and the very nature of like what the guidances that come out of OCR, which we're grateful for some of the things that they're clarifying. But those are challenges, right? So I'll stop there. And I don't know, it looks like Graham is chomping at the bit to jump in. So, see the floor to my dear colleague, and then maybe Ashok wants to jump in too.
I was just patiently waiting. I learned a fair amount there, and I agree. These are a couple of the shortfalls that and gaps that are left between HIPAA and the general consumer privacy rule that we have and set of rules we have. We have 5 state laws that have been enacted in the general privacy space. We have the Federal Trade Commission Act, which prohibits unfair deceptive acts or practices and acts as de facto the privacy statute, federally. So there are a lot of issues. I can wait till we get to the next set of questions, but I think we have to be really careful about how we treat health data as soon as it is transferred out of the HIPAA umbrella, and as Mari noted, it's being created outside the HIPAA umbrella too. And I think a wise approach for state legislators, federal lawmakers, and policymakers generally is to consider health data as something that falls into a pretty broad category of data. There's a lot of data that could be matched with other data elements that can be sensitive personal information. And so I'll stop at that point and let us move on. But I agree with what Mari is saying there. There has to be a fair amount of policy making done to put us in a better position on privacy and security outside of HIPAA.
Yeah. Thanks, Graham. Thanks for saving some for the next question. I got a 3-parter for you. So get ready. So and that moves perfectly into what I'm gonna ask you next, which is how does the growth of evolving nature of the digital health data economy impact data privacy? That's one. What steps are currently being taken to address privacy concerns or to inform consumers? And then finally, how can we best balance promoting patient access to their health information with privacy protection?
Well, one thing that is clear is that digital health tools are here to stay, and their importance is really just going to grow. If I'm right about how adoption is going, and you got 85% of American households that say they have at least one smartphone or smart device. And then you've got about creeping up toward half of Americans that say that they have and use regularly a wearable device that has sensors. And 90% of those say they use those wearable devices to track health parameters, either for wellness or fitness, or management of an actual chronic condition, or monitoring for catastrophic events like catastrophic falls, or monitoring for AFib. So what you see is that there is a lot of adoption already. And I think what we have to realize is that people are going to continue to rely on these devices, these software tools, and that reliance is probably going to increase. And so access to the ability for a patient to manage that data on their own and have access to it is a really important ingredient to the ability for those tools. And I like the premise of the question, because access to wide data sets is key to the ability to evolve in digital health. And the ability to ensure that the outcomes from algorithms, the outcomes from the use of devices with sensors, to ensure that those are unbiased, or to minimize the harmful bias that results from that. I think what we have to realize is that we need unbiased or less biased data sets. And so putting up barriers to a patient's own access to their data frustrates that purpose. And so, we have a number of member companies that provide remote physiologic monitoring platforms that, many of them have business associate agreements, but not with every provider. And oftentimes they'll have to ensure access by a patient to their own data from another health system, or whatever the case might be. And so there's a growing reliance on the interoperability of that data and access to that data in a usable format. And so, transferring data outside of HIPAA obviously creates a different set of risks. There are a lot of the risks that they're pretty similar to what you see inside the HIPAA umbrella. Some are different. One example is the creation of profiles on people, matching geolocation with other parameters that might be used in a health context, in a way, in the creation of those profiles in a way that contravenes the expectations of the consumer and the patient. That is, I think, one of the main things that Congress has to address. State legislators are addressing it now with the general privacy laws. But to the third part of the question, what is being done about better access to information about data being held on consumers? Congress is considering a bill that would, or a set of bills that would require, because personal information would fall into this category of sensitive personal information, or health information would fall into a sensitive personal information category, it would be subject to express affirmative consent for the collection and then the onward transfer of it. And so elements like that and data minimization requirements, which you don't see much at the state level, but you're starting to see it in bills in Congress, are extremely important. The context in which a consumer provides information or allows the collection of information about themselves has to be respected, and that context has to sort of dictate what a company is going to do with that information. There's too many instances of bad actors transferring onward in a way that just completely and obviously goes against the privacy policy that they make, that they publish, and the representations that they make to consumers. That has to stop. The FTC has to have much better resources at its disposal. Congress, as I mentioned, is working on that. The FTC is taking some steps too. So I'll stop there, but hopefully that gets at some of the elements that you raised.
Yeah, that was great. Thank you. Ashok, I'm really interested in your thoughts on this too, as well. I mean, given your position, you have to have some views around some of this work.
Yeah, no, absolutely, Brooke. From our standpoint, we manage over 47 million, payer lives, and also on the services side, we touch about 120 million members. So that's a lot of outreach. So totally agree with what Graham said. It's a matter of really, having discussions with FTC and HHS and other agencies, since consumer privacy and data use fall under different regulations. And we have mentioned unique considerations across use cases in response to, for example, the ANPR, the advance notice proposed rulemaking. We encourage FTC to coordinate, across different sectors for specific regulations. And as new opportunities are new, especially these days, data sharing, like for non-covered entities, because a lot of innovation, there is so much push on what is the right mix of, stifling innovation and risking your data, right? So how do you come up with that right balance? So.
Right. Okay. Thank you very much. Mari, do you want to chime in, or you want to move on? Make sure we have time for questions.
Yeah, let's move on just to make sure we keep
we get everybody in.
Our time.
Okay. Graham, I'm going to pester you one more time, back to back. So what is the role of the FTC in data privacy, and what steps has the FTC taken recently on health privacy? A little update.
Absolutely. Yeah. So I would point to three updates. So last June, the Federal Trade Commission entered a complaint against a company called Flow. It's a period tracking app, right? And Flow was transferring data about its customers to third parties in a way that was inconsistent with its privacy policy, and therefore illegal under the FTC Act, which prohibits material representations that end up being deception. And so that was a big moment, I think, where the FTC was really asserting its jurisdiction in the healthcare space and sending a message that, in particular, when it comes to the use of health data, which is especially sensitive, it's not going to be tolerated, and there will be action taken. So that was June of last year, and then a follow-on to that, and I think part of it was related to the flow case. The FTC issued a policy guidance in, I think it was September 15th, where sort of indicated that it would potentially be enforcing the health breach notification rule in contexts like the one that pertained in the flow case. So in other words, the health breach notification rule requires a company that holds personal health records, in case it is breached, there's an unauthorized access or acquisition of data that fits that definition. So personal health records, it's a requirement to notify consumers who are affected. And the FTC's policy statement sort of takes that rule and says we may be enforcing this. We read this to mean that we have the authority to go after companies that are transferring data onward on purpose. And so it's an example of, in my view, or from our perspective, it is a strained reading of the rule. But what where we sort of understand that the FTC is coming from is that the FTC is right now in a position that it has to take steps like this to stop the activity that's harming consumers in this space. And the FTC should not be in a position where it has to rely on what I think are a little bit difficult interpretations of rules. They should have the authority to police privacy harms and not just require notification in case of a breach. So, it's a good example and a good, event to sort of examine, to provide a little bit more evidence that Congress really needs to enact a law in this space. And then, fast forwarding to, I think it was July of this year, some guidance from the FTC, or it was really a blog post highlighting for consumers that there is a real serious risk of the collection of data about them related to accessing health services, to the extent that it could be matched against geolocation data in particular. And so this goes back to the profile building issue that I raised a minute ago, where to the extent companies are building profiles on them, they really need to ensure that they are taking all steps they can to maintain control over that data, and that profile is not being built in a way that they don't expect and they don't want to exist. So it's difficult to do that in this environment. But the blog post was sort of supposed to point that out, and also as a notice to companies under the FTC's jurisdiction that these are activities that are they're not going to be allowed, and the FTC is going to go after companies that are illegally building profiles on consumers in a way that is inconsistent with their consent and their expectations.
Excellent. So, we're hearing a lot about that in the context of the Dobbs decision right now. So I don't know, I want to give either of our other panelists some time to chime in on that, an opportunity to chime in if you care to, or we can move along. Graham's pretty.
Yeah. I totally agree with Graham's, comprehensive, details on this. From our standpoint, we give a lot of, there is de-identified data, but with a lot of AI, these third-party vendors are able to, gather enough information and start to offer it as a, sell it, so we feel that, okay, they have, we have given this data for a third party to run certain business functions, but they strip out, in their view, some identifiable data set, but they're still able to derive, enough information and start to sell it and say, oh, we have data for 200 million lives, and we could use it for different purposes. So, once data leaves the four walls in terms of how to protect it throughout the life cycle, and monetization of it are really big consideration. So we are putting a lot more guardrails, even if we get pressured from a broker for a large national account saying, hey, by the way, this employer wants us to share data. We still, even though we have, they have the permission, we are putting additional guardrails related to, what they would do with the data, both with identifiable and non-identifiable data sets.
Good to hear. All right. Got anything, Mari, or you want to move on?
Yeah, I mean, I think it's terrifying, honestly, that we're all wandering around, going about our daily lives with an invisible number over our head. To Graham's point about the data aggregation, I mean, what you bought at the grocery store, that's not guarded under HIPAA. It's not. What what kind of fast food you bought last Friday, how often you go in the liquor store, how employable are you? They're stringing together patterns around every American and making deductions under the auspices of selling us more targeted, marketing and shopping experiences. But don't for one second think that your political leanings or your eating habits or things that are outside of the confines of HIPAA are not being cobbled together, and they are affecting your ability to get a job in some cases. Oh, is she employable? She was out of work for a year. They don't know why you were out of work for a year. Is your last name, combined with these other things, make you unemployable? Or then you could take it further, which I was going to talk about a little bit later, but national security issues. Your 23andMe, I'm calling it better, but just any of the companies where you're putting genetic data out there, which many consumers do that, but that too can be scooped up. And, and there's a lot of good things that can come out of that, but there's also some ramifications that without guardrails, again, all this data is being put together, and technically that is health data, but it's outside of HIPAA. It's forming a picture where you're walking around with a number on your head. And I don't think that the average consumer knows that this is happening.
Yeah, I think you're right about that. It's pretty scary. Every day I'm reading new cases of, being able to use facial recognition software to re-aggregate data around somebody who, they can basically figure out who the person with the MRI was.
Well, I think that's exactly right, Brooke. You go to the airport and you're using biometrics, right?
Right.
But we
Exactly.
voluntarily send something away.
Yeah.
Okay.
No, I know we could go on. We have gone on about this, but I know you have that's your passion. So, well, let's move on just real quickly. Ashok, I'm going to come back to you. HHS has taken steps recently to promote seamless exchange of health information by promoting interoperability, expanding patients' ability to access their EHRs and their data, and prohibiting information blocking. So how do these actions interact with HIPAA's data privacy protections?
Yeah. Thank you, Brooke. So at Elevance Health, we support the federal interoperability initiatives, both from CMS and ONC, which aim to ease patients' access to their data, as well as modernize the secure data flow across the healthcare system. These regulations offer great opportunity to increase appropriate data flow for use in the right time and place, and we look forward to the pending interoperability proposed rules expected for the release soon. The interoperability and information, blockchain, provisions complement HIPAA, including, the patient right of access, provisioning HIPAA. For instance, the definition of electronic health information under ONC's interoperability rule aligns with the HIPAA definition of protected health information and includes electronic PHI included in the designated record set. Furthermore, the information, blockchain, provisions support the HIPAA patient right of access and now defines the electronic method and time for patients to get data they always has had right to. We previously noted the gaps in HIPAA coverage as well as the proliferation of the digital health tools and the data economy. With the combination of these opportunities, it's important to note and ideally, mitigate the risks, the patient data, which will have different protections and even regulatory agencies weighing in depending on if it is accessed or used by HIPAA covered entities versus a non-HIPAA covered entity. Considerations are needed as we advance care and digital tools. So also would like to add, as we get more data like race and ethnicity and language, that's going to add a lot more, because we definitely need special provisions because there is so much focus on collecting that data set, and SOGI, like related data too adds more, because we really don't want to have unconscious bias and try to defend situations because it can really, get very sensitive as more and more data gets captured. Thank you.
Sure. Mari Graham, do you have any thoughts on that?
I would add that we're pretty supportive of the agency's efforts to ensure that there is interoperability, and that includes with the information blocking rules, sort of purposes. And during the process of that rulemaking, we joined a bunch of other groups in calling for a requirement to attest, to taking appropriate security and privacy measures. If you're an app and you're receiving on behalf of a patient their protected health information, and you are not a business associate, right? So that there is at least a baseline level of notice and transparency when a patient is requesting that information. They didn't adopt that at the current stage, but I think there's still an opportunity to make those kinds of requirements. It just makes notice of that nature makes the Federal Trade Commission's job easier, absent a big federal privacy law.
Yeah.
When it goes to hold companies to their representations and sound privacy and security practices. Deception cases are just easier to bring than unfairness cases, the two prongs of the consumer protection there at the FTC. So in the short term, that is a step that ought to be taken, and we continue to work with the agency on that. But that's one thing just to note. It does not solve the entire problem, as Mari said. Patients do provide access, and consumers provide access to data that ends up being used for purposes that they didn't provide access to their data for. And that's again, that's why we need data minimization requirements. We need express affirmative consent requirements for sensitive personal information when it comes to both collection and then processing outside the bounds of the original relationship and onward transfer.
Yeah. Thank you. Mari, do you have anything that, yeah, go ahead.
Yeah, I was just saying, like at the top of Ashok's statement about like being supportive of these rules, and we're also supportive. So for those who don't know Chime, our members are largely CIOs in the C-suite who are buying and deploying the technology for hospitals and health systems and in the healthcare space. And so I would just say about HIPAA and information sharing / blocking is that it's taken a lot of muscle memory over the past few decades to educate the providers around when you're allowed to share information. And I think most people, first of all, we're all patients, would recognize that when you're, say, approaching a hospital or a doctor's office, if your first point of contact is not the doctor or a nurse, or you're talking to someone who's probably an administrative intake person, and sometimes the challenges of trying to educate those nuances regarding when you are allowed to share, when you're not allowed to share, gets very confusing for the average, clinical, non-clinical person. And we have spent decades trying to educate them on don't overshare. So now we are going to pivot and say, these are the circumstances when you actually really should be sharing. And it is very hard to move the Titanic, okay? It is very hard. People fall back on their like, oh, I can't share. And so we collectively as a community must educate everyone around the rules and responsibilities for when every consumer deserves to have their information as a patient. There are some restrictions, right? but like understanding those fine points are so hard. Even our members who are very sophisticated, you almost need like a PhD in information blocking sharing to understand the nuances. And there's still a lot of trepidation around like, oh my gosh, what's going to happen if I do the wrong thing? And so I think that that's a needle that we must thread together, and we ask for grace from the federal government as we try to do that. And there's no penalty yet for a provider. The penalties are fairly severe for other actors like the vendors. But we're trying to figure this out together. And so that I think is just one other point, is like making sure that we are doing this in a thoughtful manner, and just give grace to those people on the front lines who probably just don't understand. And so we've all been in that place where you're like, no, you can do this. You can give this to me. So I'll stop there, but just education.
100%. And you sort of jumped ahead into my next question. I have three, it's another three-parter, but I'm going to send it out to all three of you. Okay. And this is our last question. So folks, get your questions ready, get ready to jump in. So a recent survey from the American Medical Association showed that a majority of people, as you were saying, are unclear, shocking, about what rules exist to protect the privacy of their medical information and have concerns about who has access. So Mari kind of already led into this, but what is the importance of ensuring that consumers understand HIPAA? I mean, I think you've already hit the nail on the head there, but, and the FTC rule, maybe Graham wants to, because most folks are going to say, I don't want to know what the FTC rule is, right? They don't want to know. But why is it important for them to know, and to know how it impacts their healthcare data?
You want me to start, Graham, and you can take it from there?
Yeah. Go for it.
Okay.
Yeah.
Okay. I would just say, and you know, Graham's organization represents the third-party apps and has been really a leader in the security and privacy space, and we're delighted to work with them. The first thing I'd say is the consumer is going with your eyes wide open. Okay. There's kind of two schools of thought. Privacy is dead, right? Which I always cringe when I hear that, because I think it's an American value to be able to have privacy. That's me personally speaking. And then there's like well, we could probably do something to make it better, right? So I would just say go in with your eyes open, and you just need to probably assume, if you're going to be like most of us, and I unfortunately do read the terms and conditions, but I'm probably like, you know, a purple unicorn. Just know that your data is probably being sold. Okay, just accept that, and you're going to balance the risk and benefits as a consumer about when you're willing and not willing to share your information. So just do that. If you just do nothing else, and I'll hand it over to Graham and Ashok to say anything they want to say about that.
I think that's right. One of the first things that I thought of is the Think Before You Click campaign from Chime that is really, you know, designed to get consumers really thinking about when they're going to transfer data to an app, especially if it's not, you know, part of the health provider that they're, you know, going to's offerings. And so there's a number of like trying to make it really digestible things that consumers can look for. Another, you know, way of ensuring as a consumer, as a patient, that what you're doing is transferring data to a trusted entity, is go with an intermediary where there is, you know, a comparison available and there's like background information. So the big app stores on your device tend to be pretty good about curating things and eliminating apps that are, you know, run afoul of the terms of service and the privacy requirements. And then, you know, the EHR companies do have app stores as well, App Orchard and things of that nature. So there are trusted spaces that you can go to where some of that vetting is already done, because especially for our member companies, most consumers have never heard of them, and they lean pretty heavily on the app stores to provide that sort of imprimatur of trust, and that the consumer knows that they're going to be protected if they are, you know, using an app from the store.
Yeah, no, thank you, Graham. I would like to echo similar comments. I would say trust is important to patients and consumers. They have the right to know that sensitive health data is being treated accordingly. And this, the sensitive data, some of it is even, you know, being added as more data gets collected. So from our standpoint, we support the protection of, you know, patients' health data wherever it is located, as this will foster patient and provider trust of digital tools and maximize the opportunities of these tools. However, we must continue discussing ways to address concerns and promote education, including, CMS develop some guidance or value in discussions from providers to patients, and then regulatory considerations to protect health data wherever it may be. Also, there is a proliferation of, consumer tools, consumer direct tools of sharing healthcare information. I would say unless we get more aggressive on what they can and what they can't and how to manage that on a proactive basis, we'll always be reacting to different situations.
Yeah. Thank you. So we're running out of time a little bit, but I think we haven't been told we have some time to go over. Let me just quickly ask you, from the patient's perspective, this is to each of you again, what do you think is top of mind for patients and consumers when it comes to their understanding of how their health data will be used and shared?
Well,
You want to go, Grant?
yeah,
Oh,
Go ahead.
sorry.
sorry. I could go really quick. I think context matters quite a lot. And, I hate to bring up the trust issue again, but
Yeah.
whether or not they recognize the company, whether or not they recognize the store they're buying it on, and have a good sense of how the company compares to others, and whether or not the company is going to be held to the promises that it's making. There's a lot of data that a consumer has to sort of input and make a decision in quick fashion. But there is top of mind would probably be, if they're using an app on the App Store, if they're using, a connected device or something like that, that is not, part of a business associate agreement, their top of mind is going to be, what else are they going to do with my data? How is it going to be, transferred on? Is it just going to be transferred to a third party? It's going to do analytics for, to make the product better. I think that's a reasonable expectation, but anything beyond that is probably unexpected. And so there's going to be a concern. They've seen all the headlines, and we've all seen all the headlines about instances where that wasn't true, and where companies were selling data in a way that was upset the expectations in the context. So that's top of mind. And on security, it's the same problem. Are they adequately securing our data, or just storing it in plain text or something like that? And that's going to be a concern.
Yeah, I would sum it up by saying, transparency, and as long as we can have the right transparency on what we are, doing with the data and what we are not, and also have a path for the emerging data sets, I think that would build a lot of trust.
Yeah. Mari, I see your link there. You want to promote that for a sec?
Yeah. I don't know if I can't see the full chat of everyone, but hopefully Kristen or someone can share the link to we have a open source document. Anyone can add their logo to it. Think before you click, it's one page. And let me answer one of the questions in the chat from Donna regarding a use of, for example, TikTok. And number 4 on our top 5 list of things that a consumer can do when they're trying to be better informed is, know where the app was developed. Okay. I think everyone knows where TikTok was developed. And I would just, again, like, this is so wonky that the average consumer isn't probably spending their days tracking like we all do, like what's going on here. But a bipartisan effort around where information is going to nefarious nation states is certainly underway. This is, it happened under Obama, it's happened under Trump, it's happening under the Biden administration. There's an intense focus because for reasons you don't have time to go into, but you just got to know where the app was developed, and just go in again with your eyes wide open. And we're happy to share this document if you don't have it, that we developed with Weedy. The other thing I would just say is that I fear that what it will take to push a national privacy law in the U.S. over the finish line will be a catastrophic cyber incident, which you think it just can't get any worse, right? Because the hospitals get attacked every day. I mean, healthcare organizations, even outside of providers get attacked every day. But I worry that would be maybe the thing that would be the tipping point. And I just wanted to highlight that an example, and anyone can look this up on their search engine, is in 2020 in Finland, there were tens of thousands of patients whose mental health was leaked, and it was leaked by cyber attackers onto a website, and then they were personally ransomed. This is tragic. So we could all have our sensitive data out there, and then they could be individually ransoming us rather than, say, a company. So that's sort of just the fear that I hold, and I'll save the rest of my commentary for our last question.
Okay. Well, my final question is just some advice on what are some key tactics or strategy, and we've sort of talked about this a little bit, but or strategies that can be deployed to increase consumer understanding. So we know that it needs to be there needs to be better understanding amongst consumers and patients, but do you have specific tactics? And Mari, you've already touched on this. Do you guys have any specific advice for folks?
Well, one thing that a lot of policymakers have worked on in the past, and industry is now sort of developing a version of it. It is shorter form privacy notices in what's referred to, I guess, as nutrition labels, like privacy nutrition labels. It's a really, in some ways, a bad comparison because when you're talking about counting calories, it's the same for everybody. But privacy is a little bit different depending on the context, and so knowing exactly what those categories of information are and whether or not they're being transferred onward and to who, in a short form, it's difficult to communicate all that. But that effort is ongoing, and some of the app stores have this as a requirement for putting out an app now or an update to the app, especially health apps. So that's one strategy, one tactic.
Fantastic.
I would agree. I would say, on all of these health apps, focusing on, regular updates on, here is the privacy, here is additional steps we are taking, really building that confidence by, making this a priority or even as part of the product function. When new features come in, there's a good level of detail there. So how do we put the same level of discipline even on privacy as well? So
yeah, Mari, you get the last word.
All right, here are my recommendations. Arguably, these are more policy focused since we've already covered the consumer. So in the absence of a national privacy law being passed in our country, or until that happens, again, I would just point back to what Graham said. I don't call it a nutrition label, but that level of like plain English transparency at the top, so you don't have to scroll through 20 pages of 6-point font on legalese that no one could understand. So that would be great. And I think that the government, maybe even Congress might have to intervene to push that one even forward, but that should happen. That collaboration between OCR and ONC and FTC would be great. And then we encourage the FDA and OCR to work together to put more feet to the fire on the medical device manufacturer's responsibilities when it comes to handling protected health information. Number 3, Congress has passed the PATCH Act, which again puts some oversight in medical devices. Don't have to agree with everything I'm saying, just throwing out some rapid fire ideas. More education awareness and less punitive structure around providers, because you know what? Every time we get penalized and beat over the head, sometimes we deserve it, but sometimes we really don't. We're not talking about throwing stuff into the dumpster. We're talking about just being attacked by sophisticated nation states who are out, they're just like, they have far more resources and they're savvier than we are. And we just can't always, fend them off. So we should look for ways to actually incent providers to do more cyber hygiene rather than penalize them. If nobody knows what 405D is, and I can send the folks in the chat the 405D information, yes, named after a wonky area of the law. These are free cybersecurity best practices that can be used by our sector. Yay, that's great. We are grateful that OCR, again, is working on a public law that recognizes these best practices. Great, great, great. And then last but not least, super deep dive here, but there's an executive order. President Biden issued it 2 summers ago, 2021, on sensitive data. Oh boy, there's a report, haven't seen it, probably top secret. They should use it to inform how health data is used in this country. Those are my best ideas off the top of my head. But those are just a few things that could be done potentially in the interim. I don't need to have the last word. Greg, I have some ideas too.
Outstanding. Thank you all. I am not seeing any additional questions in the Q&A or the chat. Let me just make sure, Melissa or Krista, are you seeing anything else? We've been chatty, so.
Oh, nope, I don't think there are any other questions. So at this point, I will say thank you to you, Brooke, and thank you to our panelists, and we will go ahead and transition to our next speaker.
Thank you.
Thank you all for the wonderful insights and recommendations. Mari and the other panelists, Mari, Graham, Ashok, you gave us a lot to think about. So as we move into the next section of our agenda, we're going to be transitioning to state perspectives. So a lot of our content so far today has focused on federal perspectives, but we cannot ignore the fact that the states are very important as we think about state privacy laws and overlay with the federal frameworks that are in place. So we are delighted to have Mujay Fazlaolu here today to discuss navigating state approaches to protecting data privacy. She leads privacy law and privacy research at the International Association of Privacy Professionals. She completed her PhD in law and social science at the Marr School of Law in Indiana University in Bloomington, and holds an LLM in European law from Stockholm University. Prior to joining the IAPP, she was a research fellow at the Center for Applied Cybersecurity Research and the Center for Law, Ethics, and Applied Research and Health Information at Indiana University. Her research into privacy law has been published in International Data Privacy Law and Fordham Urban Law Journal, and cited by institutions such as the European Parliament and the United Nations, amongst others. Just, you know, teeny tiny little governmental organizations there. No big deal. So anyway, we are so happy to have you here, Mujay, to help bring us into a discussion on state perspectives.
Thank you very much for inviting me to be here. I'm very excited to talk to you today about privacy law. What I will try to do is provide as best as I can a picture of US state privacy laws and the regulation of health information at the state level, with a few ideas for organizations and companies to keep in mind. Certainly not illegal advice, but some useful information, I hope. First, let me talk just briefly, perhaps as more as a refresher, about the nature of the US approach to privacy regulation, the sectoral approach as it's called, as well as the dynamics of interplay between state and federal law. Overall, I think it is fair to say that there is a gap in US privacy law, or multiple gaps. On the one hand, in contrast to a lot of other countries, we lack a comprehensive federal consumer privacy law or an omnibus federal information privacy law. And also, in contrast to a lot of other countries, and the EU's GDPR in particular, regulation of information privacy in the US takes what's called a sectoral approach, meaning that laws are targeting at information based on its nature or type. So, as I'm sure you're all well aware, a gap exists in the sense that HIPAA doesn't regulate much of the health data generated by mobile health apps, fitness trackers, or other emerging technologies. One privacy expert has even estimated that the majority of health-related data falls outside of HIPAA's scope. The challenge for lawmakers is to try to address these gaps in the law and keep up with new technologies while working within a federal system. That's at least part of the reason why state privacy law has evolved the way it has, with Congress in a stalemate on what to do about these problems, and with states taking the lead. In our system of lawmaking, states have traditionally served as the laboratories for democracy, in the words of Supreme Court Justice Brandeis, but labs can get messy, and so there is a lot of overlap and complexity that is generated by a mix of federal and state regulation combined with the US's sectoral approach. So there are indeed many different sectoral state laws that pertain generally to the topic of health information. For example, there are genetic related information laws in many different states, which typically prohibit disclosure of genetic testing information and apply to any entities, including healthcare providers who possess that information. At least 7 states also have biometric privacy laws, the most notable of which may be the Illinois Biometric Information Privacy Law, enacted in 2008, which regulates use of data on things like fingerprints and voice prints. But what has gotten the most attention recently at the state level are the broader consumer privacy laws. And it's these laws, all of which are coming into effect next year, that are really being expected to fill these gaps I talked about a moment ago. So let me talk a little bit about the 2023 class of consumer privacy laws. So joining California, the new consumer privacy laws in Virginia, Colorado, Connecticut, and Utah will all go into effect in 2023 at various times throughout the year. And the enforcement of CPRA is also set to begin on July 1st. So I want to talk briefly about a few key questions regarding these laws. The first being their scope and exemptions. The second being how they define sensitive data. And the third being the rights and obligations they enshrine. So one of the first questions privacy professionals usually ask regarding any new law is what is its scope? And these new laws in California, Colorado, Connecticut, Virginia, and Utah generally apply only to certain for-profit businesses that meet certain thresholds and tend to exempt state and local government agencies, nonprofits, and institutions of higher education. And there are other different ways in which someone or something might be exempt or excluded from one of these laws. First, as I said, there can be exclusion of an entity in its entirety based on the nature of its business or structure, but there are some exceptions even to that. For example, nonprofit organizations are exempt from the business requirements of CPRA, but may be subject to the requirements placed on service providers, contractors, or third parties if they happen to fall into one of those categories. Second, there can be certain types of data that are exempt, no matter where or by whom it is collected or processed. So employee and HR data are generally exempt from the state laws except CPRA. And in general, de-identified data is also excluded from the definitions of personal information or personal data in these laws, as is information that is publicly available, such as in government records or in the media. And all the state privacy laws have some kind of HIPAA-related exemption, but they differ in important ways. In terms of exemptions for HIPAA and health information. The broadest is contained in VCDPA. So Virginia's law exempts covered entities and business associates and protected health information as defined by HIPAA, as well as certain other types of health-related information. And Utah and Connecticut mostly mimic this exemption. However, CPRA only exempts protected health information under HIPAA and providers of healthcare and HIPAA-covered entities to the extent they protect patient data as required by HIPAA and the California Confidentiality of Medical Information Act. In other words, healthcare providers are not generally exempt from California's consumer privacy laws at the entity level. Instead, CPRA provides exemptions concerning health-related data sets. Specifically, protected health information collected by a covered entity or business associate is exempt from CPRA's requirements. Thus, a healthcare provider might still have CPRA obligations, but not with respect to protected health information or patients. Put differently, to the extent that an organization collects data on individuals who are not patients of the organization, the HIPAA exemption may not apply. Colorado, like California, also doesn't broadly exempt HIPAA entities, but has a broader exemption that broader exemption than CPRA of protected health information and certain other types of health-related information. So after walking through some of the questions related to scope and exemptions, the next important step is to take a more detailed look at the definitions within the laws. Each state law's definition of sensitive data is different. And so what kind of health-related information would fall within the scope of each is an important question. In the US, regulating sensitive types of information such as financial information, children's information, and health information is another key feature of our system of privacy laws. And so these laws extend this approach by recognizing certain kinds of information as sensitive and deserving of heightened protection. For example, genetic information and biometric information are considered sensitive data across all 5 state privacy laws as information that reveals a physical and or mental health condition, as well as information about an individual's sexual orientation. Information about an individual's sex life is also recognized as sensitive data under California's, Colorado's, and Connecticut's new laws. In addition to variances in how sensitive data is defined within each law, the laws impose different sorts of requirements related to their collection and use. The CPRA, which defines sensitive data most broadly, establishes an opt-out scheme for the processing of such data. Meanwhile, the Colorado, Connecticut, and Virginia privacy laws contain more limited definitions, but require consent before a data controller can process sensitive data. Utah's protections reflect both approaches by having a more limited definition of sensitive data, but follow an opt-out scheme similar to California's process, where the data controller must present the consumer with clear notice and an opportunity to opt out of processing. So for those who would like to read further on this, there is a great recent article written by one of our IPP's Western Fellows, Amy Olivero, about the differences between state laws in terms of how they define sensitive personal information. And she looks particularly at challenges posed by reproductive health apps and related technologies. Lastly, I wanted to touch briefly on the extent of rights and obligations that these laws enact. Most importantly, they provide a set of rights to consumers. These include the right to access and to confirm that their personal data is being processed, the right to delete their personal information, the right to correct inaccuracies, or the so-called right of rectification, and the right to data portability. Most of these laws also include several opt-out rights, including the right to opt out of sales of personal data, the right to opt out of targeted advertising, and the right to opt out of profiling. So lots of opt-outs. And they also provide a right to non-discrimination with respect to price and service differences, although CCPA and CPRA are more onerous in this regard. So all of these laws set specific privacy policy content requirements and obligations to maintain reasonable security practices. And most of these rights are consistently found throughout each of the 5 laws. And then there are some rights that are unique, usually only found in California, such as the right to object to or opt out of automated decision-making, and the requirement that businesses provide notice at collection. So certainly there are a lot of complexities to unpack, but I hope that this has at least mapped out the basic coordinates for the health information privacy landscape in the US and its regulation at the state level.
Great, thank you, Mujay. We will take, we have a couple questions just to ask if you have a few moments for questions, and then we will move on to the next thing. But I wanted to ask you, given that HIPAA-covered entities must navigate HIPAA compliance as well as state privacy laws, is there a model among the various states that's worked well? I know we talked about Virginia and California and several different states, so I wasn't sure if there is one law that is sort of the model that or if there's multiple laws, or if there are pieces of the laws that have served as a model.
So I would say they all work well to some extent in terms of certain things they're trying to achieve, even if they have different and or conflicting policy aims. So when we describe state privacy laws, we often use the term patchwork, which is accurate to some extent, but another way I like to think of it as a system of 2 tiers, which I think may be just as accurate to describe the current group of state laws. And I think it's fair to say that CCPA, CPRA, in many senses, is the strictest. And that arises partially from the legislative history in California, which is unique. CCPA and CPRA both originated as ballot propositions and had a very different group of non-state actors at the center compared to Virginia, for example, which came into being through a more industry involvement and lobbying. And what CCPA, CPRA really intends, first and foremost, is to increase consumer awareness about data uses. At its heart is really the right to know, to be informed about the data businesses are collecting about you. So it's based on the model of notice and consent to fair information practice principles, which have been staples of data protection law for decades, but it's far from a perfect model and being criticized a lot. But it's also being asked to do a lot. So I think there is still room for other models, maybe a focus on harms, the concept of data stewards or data fiduciaries, and risk-based approaches are all alternatives, or maybe supplements to notice and choice that can entail fewer unnecessary burdens on businesses and bring benefits to consumers.
Okay, great. And given the momentum that we seem to have now for at the state level momentum for comprehensive privacy bills, it seems really high right now. Do you think that this will continue, or what do you see happening in the future as far as desire for state action?
So here I wanted to do a little plug for some of the resources that IPP has and some of the research we are doing. Of course, our state privacy legislation tracker follows all the state privacy laws that have been introduced each year, where they are in the legislative process, and summarizes their main provisions, including the ones that have been enacted. Regarding the trends, our team also tracks the growth of proposed state legislation over the years. So going back to 2018, we saw 2 states that considered privacy laws, which one being passed, which was the CCPA. Then in 2019, 13 states considered law, but none of them passed. In 2020, 16 states considered laws and 1 was passed. Then there were 23 bills considered in 2021 and 29 considered in 2022, with 2 passing each of those years. And taking this big picture view, I would actually say the trend over the past few years has been that anywhere from 0 to 2 states have passed a comprehensive consumer privacy law. So if the trend continues, and that's always a big if, we might expect to see 1 or 2 new state laws in 2023. So there really never is a dull moment in the world of privacy.
Yeah, you're right. Never a dull moment, and especially now. So we want to thank you for your time. We did get some questions in the chat about various resources that you have available. And so we have shared some links in the chat, but we will connect with you afterwards and also try to see if we can post some of these resources or cross-link to your website. So thank you so much for this really valuable analysis.
Thank you.
Great, thank you. Okay, so now that we've sort of set the stage with a federal perspective and a state perspective, starting with the administration on the federal side, we're going to shift back now to the federal side and share some congressional keynotes and some congressional speakers. So as I mentioned when I gave the brief overview of sort of the landscape before Director Fontes Rainier came on, there has been a lot of action at both the administration and in Congress. So Congress, as I mentioned, the session has made it further on comprehensive privacy legislation than they've ever made it in the past. And we've also seen a lot of action around specific laws that would protect reproductive health data. So we are going to kick off our congressional section here with some remarks from Representative Sarah Jacobs. Representative Jacobs was elected to the House of Representatives in 2020 and serves California's 53rd Congressional District. She is a strong advocate for the protection of personal reproductive health data and has introduced legislation such as the My Body, My Data Act to prevent this type of data from being disclosed or misused. So she will share her thoughts on the topic of data protection for reproductive health data in particular. And if you will bear with us, we are going to link to her remarks since she pre-recorded.
Hi, I'm Congresswoman Sarah Jacobs. Thank you to the many organizations for convening today's Health IT Leadership Roundtable to discuss the importance of data privacy in healthcare. Since the Supreme Court overturned the constitutional right to an abortion in June, millions of Americans, myself included, have new concerns about our data privacy, especially when it comes to our reproductive and sexual health data. But the scary truth is that these threats to our personal data have long existed. So it's long overdue that we recognize these vulnerabilities, understand their scope and severity, and address them quickly. It probably won't surprise you that at 33 years old, I'm one of the youngest members of Congress and one of the few women of reproductive age. I'm also one of the millions of Americans that use an app to track my period. But right now, there are almost no federal protections for this data. And it's not just apps. We leave sensitive medical and location information behind in online purchases and browser searches too. If you're Googling how to obtain an abortion for yourself or a friend, if you're ordering abortion pills online, if you're using Uber to travel to an abortion, all of that is unprotected. In the post-Roe era, this information could be sold to the highest bidder or subpoenaed by law enforcement. In fact, we're already seeing horrifying cases of this. In August, police obtained Facebook messages between a mother and daughter in Nebraska as part of an investigation into an abortion that was illegal under their state law. In October, there were reports about Florida High School Athletic Association asking student athletes very personal details about their periods, and then hosting that information on an app that's not protected by HIPAA. In a state with a 15-week abortion ban and an anti-transgender sports ban in effect, storing this information online leaves a digital footprint that can be searched and seized and easily used against someone. These are just a few examples, but they're symptoms of a nationwide problem that requires a federal solution, and that solution is my bill, the My Body, My Data Act. It would create a new national standard to protect personal reproductive and sexual health data, like what's in period and fertility tracking apps, Google searches, location data, and more. Under my bill, companies and nonprofits can only collect, retain, or disclose data that is strictly needed to provide a requested service. You can ask for your data to be deleted at any time. They can't sell it, and they can only share it with your express written consent. The bill gives FTC rulemaking and enforcement authority, and it also has a strong private right of action, giving individuals the power to sue if they think their data is being misused in any way. These strong enforcement standards are critical, so we can take our power back to ensure that consumers are the ones in control of our own private information, our digital selves, and our own bodies. The bill also has a state non-preemption clause to protect existing privacy laws and future innovations in states like mine in California. I'm so proud that the My Body, My Data Act has the support of 117 House members and that Senators Hirono and Wyden are leading the companion bill in the Senate. And while my bill can't solve every possible scenario that will happen in the post-Roe era, and no one bill could, it's best positioned to meet the post-Roe moment and protect our reproductive and sexual health data. We know some individuals are already taking matters into their own hands and minimizing their data so less of it is at risk. In fact, in the days immediately following the Dobbs decision, I heard from so many panicked friends and constituents asking me if they needed to delete their period and fertility tracking apps. Videos of women and LGBTQ+ folks rushing to delete their apps and encouraging others to do the same were trending on TikTok. And yes, some companies are voluntarily deciding to do the right thing and protect this data. But we can't rely on the goodwill of businesses, and we shouldn't put it on individuals to figure out how to keep their data safe. It's the government's responsibility to step in and step up to create a federal standard for protecting this information, lifting the burden from businesses and protecting individuals. And that's why we need the My Body, My Data Act. These issues are clearly very complicated, and it's why I'm so glad that you all are taking the important step today at the Health IT Leadership Roundtable to break down these issues, understand what's at stake, and identify and push for solutions. So thank you all for your advocacy for digital privacy in healthcare, especially when it comes to reproductive and sexual health. This data is so important and it can't be overlooked because it does affect all of us. So thank you so much. It's such an honor to be doing this work alongside all of you.
Great. I'm sorry. I think my video might be having an issue now, but I want to go ahead and transition to the next congressional speaker. So it is Senator Amy Klobuchar. So Senator Klobuchar has been serving in the United States Senate since 2007 and represents Minnesota's 7th Congressional District. Senator Klobuchar serves as the chairwoman on the Judiciary Subcommittee on Competition Policy, Antitrust, and Consumer Rights, where she has worked to reinvigorate America's antitrust laws and restore competition to American markets. Additionally, she has worked with senators across the aisle to introduce legislation such as the Protecting Personal Health Data Act to address the emerging health data privacy concerns presented by new technologies. And bear with us while we're pulling up her video.
Hello to everyone attending the 5th Health IT Roundtable. I'm so glad that I can share a few words with you today on the need for strong data privacy laws to protect consumers. Conversations like today's roundtable are so important because time and time again, we've heard big tech companies say, just trust us, while prioritizing their profits ahead of our safety, privacy, and well-being. We know that so much of these companies' power comes from their unfettered access to our data. They reap millions of dollars in revenue from selling our information to advertisers, while consumers are left in the dark without any protection over their sensitive data, including personally identifiable health information. That's why I'm leading legislation called the Stop Commercial Use of Health Data Act. Okay, can't be more direct than that. Stop Commercial Use of Health Data Act with Senator Sheldon Whitehouse to ban the use of personal health data in commercial advertising. And I'm also working on bipartisan legislation called the Protecting Personal Health Data Act with Senator Lisa Murkowski of Alaska to address privacy concerns surrounding new health data tracking apps and technology. Both these bills will enhance Americans' privacy by giving consumers a greater say in how their health data is shared online. But we know that these companies' data collection practices aren't just limited to personal health information. That's why I'm also focused on comprehensive federal privacy legislation so that Americans can use the internet knowing that their data is safeguarded. Here's an interesting stat. If you are an American with a Facebook account, your data brought in $51 to Facebook in a single quarter last year. Think about that. But if you're a European Facebook user, because they have some rules to protect users, your data only brought in $17. That disparity is largely a reflection of how our country's data privacy laws simply aren't strong enough. The European Union has a General Data Protection Regulation, also known as GDPR, and we have no equivalent, putting American consumers at a systemic and significant disadvantage when it comes to safeguarding our information. That's why I'm working with Senator Maria Cantwell on her Consumer Online Privacy Rights Act. This bill would put in place a number of critical privacy protections, from giving consumers a choice to opt out of having their data collected for third-party and targeted advertising purposes, to allowing people to access and control how their data is being used. Our bill would also limit the amount of information companies can collect and process and establish strict standards for how they use, share, and secure consumer data. I'll keep pushing to get this bill done. I truly believe that this is our moment to ensure that Americans can continue benefiting from tech innovations without sacrificing their data privacy and safety. So know that as we move into the new Congress, I'm going to continue fighting to safeguard our sensitive health data. More and more people are coming to our side, creating digital rules of the road for privacy that every company must follow, because it's time to stop admiring this problem and actually take steps to solve it. Thank you again for convening this important discussion. Enjoy today's roundtable.
Great, thank you. Our last congressional speaker is Senator Wicker. So Senator Wicker has been serving in the United States Senate since 2007 and represents Mississippi's 1st Congressional District. Senator Wicker is the ranking member of the Senate Committee on Commerce, Science, and Transportation in the 117th Congress. He has been a longstanding advocate for data privacy legislation that would protect Americans of all ages and provide a national standard for businesses to operate. In 2002, Senator Wicker, along with Representatives Pallone and McMorris-Rodgers, introduced the American Data Privacy and Protection Act, a bipartisan, bicameral piece of legislation that offers the first comprehensive federal data privacy and data security bill in the United States.
Thank you, Kristen. It's a pleasure to join all of you for what I hope has already been an insightful roundtable. As digital technologies continue to develop and improve the quality of life, it is clear that Americans are also growing more concerned about the privacy of their data. This concern grew significantly during the pandemic when so much of our daily lives went online. Even as millions of Americans enjoyed the remarkable benefits of telehealth, questions remained about the privacy of our health records and who would get their hands on them. During that time, cyber attacks and data breaches rose significantly, and today it is virtually a daily occurrence for an entity to misuse someone's personal data or try to process it in a discriminatory way. Americans are now widely aware that their data is being bought and sold. And patients are right to be concerned that their health records could end up in the wrong hands and be used against them when it comes to insurance and employment. These are serious concerns and they must be addressed. Without strong safeguards, we risk losing consumer trust in the internet marketplace, undermining our nation's technological leadership, and missing out on the promise of digital health systems. I've long advocated for data privacy legislation that would protect consumers and provide a national standard for businesses. And over the last couple of years, there has been a growing recognition in Washington that federal action is needed. As ranking member of the Senate Commerce Committee, I have received input from numerous industry stakeholders, academics, and consumer interest groups about the best path forward. The culmination of these discussions is the American Data Privacy and Protection Act, which I have introduced along with Representatives Frank Pallone and Kathy McMorris-Rodgers, who lead the House Committee on Energy and Commerce. This landmark bipartisan bill would create a strong national framework for data privacy and security, offering protection to consumers and operational certainty to businesses. Among other things, it would grant civil rights protections for Americans against discriminatory use of their data. It would cap the amount of data that entities can collect on individuals in the first place. And it would require covered entities to let their consumers turn off targeted ads. These steps are critical to keeping the American people's trust when it comes to digital systems that could revolutionize our way of life for the better. These digital systems are still very new for most Americans, and now is the time to get the law right. I was encouraged by the strong bipartisan support for this groundbreaking legislation. Yet there are still improvements that need to be made. For example, making sure we don't impose additional requirements on health data, which is already protected under federal law. As we head into the 118th Congress, I'm confident that momentum around this bill will continue to build as we perfect the language. The digital space is constantly changing, and we need to act soon. I look forward to continuing this important conversation and hearing your thoughts in the months ahead. Thank you all, and enjoy the rest of the roundtable.
Great. We were so pleased to have Representative Jacobs, Senator Klobuchar, and Senator Wicker share their thoughts on privacy. As you can see, there's a range of perspectives, a range of activities with lots of potential impact for the healthcare industry. So we thank them again for sharing their thoughts. At this time, we are going to move in right on schedule to our second panel. So again, bear with us as we bring up the panelists. You see the full list of folks listed here on the slide. This panel is going to address protecting non-HIPAA covered data. I think Mari really laid it out there earlier in panel one when she's, said that it's possible that today the scope of non-HIPAA covered data is even bigger than the scope of HIPAA covered data. So that is something really thought-provoking as we get into this panel. I will turn now to introduce our moderator, Lauren Choi. Lauren is the Managing Director of Health Data and Technology Policy at the Blue Cross Blue Shield Association. In her role, she leads the development and execution of BCBSA's policy thought leadership around innovative health technologies and data strategy, including health, financial and equity data, virtual care and telehealth, interoperability, technology standards, and social determinants of health data standards. Lauren has over 20 years of experience in Washington, D.C. with deep expertise in policy, business strategy, advocacy, and law. And I can think of no better person to moderate this panel of experts. So Lauren, I will turn it over to you.
Great, thank you, Kristen. We're really excited to be here, and I want to sort of start off by saying thank you to all of you who are participating today, and also to our panelists, and also to Kristen and her team in putting together an amazing session that really focuses on privacy and kind of the nexus of where health data sits in terms of between HIPAA and sort of the consumer privacy laws. So I wanted to sort of start by building on the discussion from today. Throughout the day, we heard from the panel, the industry panels on kind of the current state. We also heard from the state folks as well as OCR, and really focus on what we hope to focus on in this panel is really the non-HIPAA covered data and what that means. And how do we protect it? So how do we define it? How do we protect it? And then, and at the end of the day, really, sort of for maintaining consumer trust. So a couple of housekeeping rules, and I'm going to get into introducing our panelists and then also get into some Q&As. If you have any questions, we really want the participants to be interactive with us here, to add your ideas and questions. So please feel free as we go through to add your questions in the chat, because this is really what we're hoping to do is really kind of get into a full robust discussion. So with that, I'm going to introduce our panelists. So I'm going to start with, in an alphabetical order, David Brody, who is the Managing Attorney for Digital Justice Initiative at the Lawyers Committee for Civil Rights Under the Law. Andy Crawford is a Senior Counsel, Data and Privacy Project at the Center for Democracy and Technology. Nadia Dashbar, and I apologize that I sort of screwed the last name up, associate, who's an associate at the Health IT Policy at the American College of Physicians, and then Cora Hahn, who's the Chief Health Data Officer at UC Health at the Office of the President for University of California. So just a little framing. I know we're all excited to get into a robust discussion here. A little framing is that we have to have a discussion about how to gain and maintain consumer trust. So what does that mean? And especially in this evolving environment, as we heard today, right? There's a convergence of technology and healthcare delivery, management, and innovation. And what does that mean in terms of the existing legal and protection framework? And so what we wanted to do was kind of talk about what the gaps are, and then start in on how do we take a holistic view of existing frameworks and laws and protections and see if there is ways that we can reform looking to the future. So we, and so at the end of the day, we hope to sort of surface some additional and new ways to protect consumer data. And what does that look like? That's the other question, especially through the actions of Congress and regulators, which I think we heard today that OCR, as well as the members of Congress, and there's a lot of interest in engaging and really looking at how we protect and build and maintain consumer trust in this world of wearables, technology, telehealth, all the technology infrastructure that gets embedded into our delivery and management of healthcare. So with that, I'm going to start with a couple of questions for our panelists. And this is, this is a question for all the panelists to start. So the first question is, What do you see as the biggest challenges and gaps in current privacy protections around consumer health information? And we're talking about the digital health and wellness tools, telehealth, which we saw a lot of being delivered through via smartphones during the pandemic. What do you see as the biggest challenges and gaps in current protections today? You want to start, David?
Sure.
Or anybody?
I can jump in on that. Sure. I mean, so I think the biggest challenge is when we're talking about things that are not within the scope of HIPAA, there really isn't any protection at the federal level, not anything meaningful. There is no comprehensive privacy law that is going to protect what you search for on the internet if you're searching about health conditions or medications. There's nothing that protects your location data when you're traveling to a doctor's office or a psychiatrist's office. There's nothing that protects the purchases that you make at CVS, outside the pharmacy. And so, the only real protection at the federal level is some ad hoc enforcement from the Federal Trade Commission. And that historically has been very limited to companies that engage in deceptive practices. And what that means is if a company engages in a practice with your private information without disclosing it in their privacy policy, then the FTC can conduct an enforcement action against them to cause them to fix their ways. But as we all kind of know, those privacy policies are gigantic and no one reads them, or very few people read them. I think Nadia is going to talk more about that. And so, it's not really much protection to say, oh, you buried a sentence in a giant document, and therefore, you can do whatever you want with data. There's some state level protections. California has passed a privacy law. Illinois has a facial recognition and biometrics law. And a few other states have some limited privacy laws as well. But there just isn't protection right now.
And I'll just build on what David said to emphasize kind of the implications of that, because I think David did an excellent job of outlining, the current state of affairs outside of HIPAA. And what that translates to is that we as consumers, we as patients who move our health data outside of HIPAA space, it's really incumbent upon each of us, if we want to take agency over our data, to read each of those privacy policies. There is no universal standard. There's no federal privacy law right now that says these data practices are permissible, these data practices are not. You can share data this way, but you can't share it this other way. You can share it with these parties, but you can't share it with this other party. You can use it for advertising, you can't, right? So in the current environment, it really is on each and every individual to take the time, which is a lot of time, if they want to determine what they're comfortable with. And that happens, if you were to actually do that, that's an immense amount of time, because that's every website you go to, potentially you're trying to determine the data usage of that website, every app you use, every connected fitness device. And it's just, that's an unworkable system right now. So we really need to readjust the levers here and put more of the responsibility on the entities that are collecting and using that data to say, these are acceptable data practices, these are unacceptable.
And I'll just jump in and build upon both of those comments. I think one of the reasons why this gets particularly tricky when it comes to sensitive health data is that when consumers go in and they see their doctors, they have this feeling that that information is going to be protected. And so when you're talking about the same or similar types of information that is now being collected and generated outside of that HIPAA bubble, you have consumers not really understanding that there are different or lesser protections that might apply. And that, to the extent that we, want to move towards a place where data use, sharing, collection is in alignment with what consumers reasonably expect and what their preferences and choices are, it creates more of a misalignment.
Yeah, and I would actually just add, so I think everyone's done a really good job of summarizing what the FTC does and how it applies, but essentially with data that falls outside of HIPAA, consumers or patients are basically left at the mercy of what is in these privacy policies in terms of use agreements and end user license agreements and so on. And usually those privacy policies can be pretty skimpy. They can be in different languages. They can be really long. Short privacy policies could be bad. Long privacy policy could be really bad. And usually, even if a person takes the time to read them, which a study from 2008 had indicated that for a person to read every privacy policy that they encounter in a year, it would take 76 days, which is just untenable and unrealistic and not consumer centric or friendly. And so, yeah, even if a person does read them, it takes forever. And then furthermore, as a study that I participated in showed, a lot of the privacy policies don't even actually say what they do. And that's where the FTC regulation comes in. The FTC can hold app developers accountable when they do things, for instance, transmit data that they claim they wouldn't be transmitting in their privacy policies. So that's the significance of FTC regulation and the gaps.
Well, thank you. And just to kind of add to that, I think what we heard today from OCR, Melanie Fontes Rainier, was that they are working with FTC. And to some extent, it sounded like, and I think she was in response to one of the questions, was that there are limits to what they can do in terms of alignment of HIPAA. So I like to open it up to the panelists here in terms of what are the current sort of alignment or lack of alignment that you see in terms of between HIPAA and non-HIPAA, and who's sort of catching the gaps? In other words, is it the state authorities? Is it some other, enforcement or protection mechanisms that we can achieve, given the gaps and given the kind of lack of alignment? Can I maybe shoot that over to either David or Andrew first, or Cora?
I'll take a first stab at other folks. Please dive in. So, I mean, I think having listened to all the panels today, right, I think we've made it clear that the gaps are persistent and exist, in that outside of HIPAA, you're really in a kind of amorphous space where the real only, at least at the federal level, entity that's going to be the regulator is the FTC, and within that space, they're going to be using their deceptive practices in unfairness jurisdiction. So what that means realistically for all of us who, right, we like technology, we like to use this stuff. I like to know how many steps I've taken and track my workouts. That's cool. But right, like if my data is used in a way that I don't anticipate or I don't want, it's really on either me to catch it and take affirmative steps to stop that. But if I'm really harmed, and if I want to take that up to some sort of enforcement entity, it's really going to be probably up to the FTC, and that's going to be incumbent upon either me identifying misrepresentation in a policy or a deceptive practice, and that's not a system, I think, that is, as others have noted, very consumer friendly or basic, just fundamentally, privacy centric and privacy protective. It's much more the opposite. It's permissive, and then it's up to limited stopgaps to try to catch some harmful acts. But I'll pause and let others weigh in too.
So I'll just make two quick points. I mean, one, I feel as though, so HIPAA it was never intended to be a comprehensive privacy law for all health data. That's not what it was, it was meant to do. It's operated, I think, well in that sphere, but what it does create is, I think, to build off of what Andrew said, more and more now, what happens is that you may use an app and you may use it for your own personal use, and you may even understand that is for your own personal use. But then there are many other situations where now more and more people are taking that information, they want it to become part of their health record, or their doctor is suggesting that they use this blood pressure tracking app or another kind of technology, and that data is not subject to the same set of protections, and so that is where you have, I think, issues with, okay, so what are the guardrails around the collection and the use and the sharing of that data, and how do we get to a place where those protections are stronger?
And just to drive home a little bit, some of the harms we're concerned about here and why this is such a big issue. When this data is not protected, and right now it isn't protected, what we've seen time and again is that this information gets used in other contexts in ways that have discriminatory impacts and unfair impacts. There's studies showing that big data algorithms have steered healthcare and hospitals in discriminatory ways, giving Black and white patients different levels of service. There's studies showing that some of these big data algorithms are used to provide differential rates for insurance, whether it's not necessarily just healthcare insurance, but car insurance, life insurance. And we've seen plenty of examples of this type of extremely sensitive information being used to make decisions about mortgages, interest rates, job opportunities, ads for jobs being steered disproportionately to men or women, to Black or white applicants. And so, what we're concerned with here is it's not just necessarily, some data broker is going to know how many steps I took, or that I'm on this heart medication. Like, what's the harm in that? These are individual pieces of a broader mosaic that time and again has been used in a way that discriminates against historically underserved communities, in a way that disenfranchises those who do not have as much socioeconomic power, disenfranchises them from opportunities. And so the reason we need to protect this information, the reason we need comprehensive data privacy protections, is that if we want equal opportunity in a data-driven economy in the 21st century, we have to prohibit the algorithms and other big data technologies from replicating and amplifying the historic inequities of the prior centuries.
And I'd just like to add some other implications of the current ways that health data is being handled in the health ecosystem. So one of the central tenets of healthcare from the standpoint of physicians is maintaining a culture of trust in the physician-patient relationship. It's crucial to actually provide good quality healthcare. And when we're in a situation where people don't know and can't control how the healthcare system uses their data, and it isn't necessarily protected, we get to a place where physicians don't know if they can necessarily trust that the patient information that they're seeing, not only is it protected, but is it complete or is it accurate? And we also get to a world where patients feel the need to withhold or forbear sharing of certain sensitive health information with their physicians. And this can actually have really negative implications for their actual clinical health. And we're actually in that world already. There's been studies that, indicate that patients do lie to their doctors because of concerns of privacy.
That's
And
really helpful. Oh, go ahead, Cora.
sorry, I was just gonna, the final thing I'll add is that also trust is important because there are very, very real, I think, in the health area benefits that can come from using these technologies. And so not just for individuals, but also, as we've seen with COVID, for public health purposes, there are important uses that can improve patient care, that can improve population health. And so I think there's also, one of the things to really think about is, okay, how do we reap those benefits while mitigating the very real and very serious harms that we are all laying out today.
So that's a great segue to what we heard during, in the discussion just now, is really kind of how do you balance the benefits with the risks, or how do you protect the privacy needs of consumers, but at the same time, there are ethical uses that should be allowed in some way, but standardized perhaps, so that it's not everybody doing their own thing, which does not build sort of consumer trust or understanding. So with that in mind, clearly I think we've established that in prior conversations as well as this panel, that there are some gaps because, as Cora mentioned, HIPAA is not really meant to be a cover, as kind of a data, protection for all health data that may or may not sit within the realm of HIPAA, and that. So with that in mind, that question in mind, and kind of the presumption that there are gaps, there are some congressional legislations and proposals. I think we heard from Clovis, the members of Congress before, that's out there. And I know one of them was the American Data Privacy and Protection Act. Now, I wonder, and this is a question for the panel, in a sense, given the gaps that we've sort of identified and the challenges that existing regulatory authorities may face, what can Congress do? So that's a broader question. And then maybe discuss specific legislations that you're aware of or that you were engaged in that may parts of it or holistically has the appropriate approach and so forth. Because at the end of the day, what we're hoping to get to, and this will be kind of our next set of questions, is what does that kind of the holistic privacy protection paradigm look like? Given the current state of innovation and use of technology in our healthcare. So with that, maybe I'll open it up and whoever wants to take it on first.
I can jump on that because ADPA is sort of the thing I've been working on the most this year. ADPA is a comprehensive, bipartisan, bicameral privacy bill. And it's the solution. It's the right answer. And I say that, with the disclaimer that my organization, the Lawyers Committee, has endorsed the bill, as have many other civil rights and civil society groups. And, we really commend the leadership of Senator Wicker and Chair Pallone and Ranking Member McMorris Rogers, who have worked together in a really good faith bipartisan manner to craft a compromise that, no one's getting everything they want, but everyone can go home satisfied. This is the way that Congress is supposed to work. This bill is how legislation is supposed to happen. And so what ADPA does is it's applying to all types of businesses and all types of data, and it's fundamentally a data minimization regime. So it's saying that businesses should only collect and use and transfer as much personal information as is reasonably necessary to something that a consumer expects or requests, or certain other types of specific authorizations, things like data security, fraud prevention, things like that. And then it also establishes higher data minimization protections for sensitive information. And that includes health information as well as financial information, location information, certain information about kids, and a number of other categories. And then the beauty of ADPA is it's not based on consent. You don't have to have everyone, clicking a box every time they go to a new website or agreeing to some privacy policy. Consumers get a baseline consumer protection standard so that they know that when they use a product, when they patronize a business, that business is complying to a minimum set of standards. Just like when you drive a new car off the lot, you can be assured that the engine's going to work, the car is going to drive, it's going to have airbags, and it has met a certain level of consumer protection standards. The bill also has really strong anti-discrimination protections that prohibit using personal data in a manner that discriminates on the basis of protected characteristics like race and sex. It requires large companies to audit their algorithmic processes for bias and to mitigate those issues. It has data security provisions, it has transparency provisions, it has some individual controls to give individuals the right to access their personal information and correct inaccuracies, which is really important in the context of something like non-HIPAA health records. And then it establishes a balanced enforcement regime where the FTC, state attorneys general, and individuals can enforce their rights. In exchange for all of that, what it's doing is it's setting up a federal standard. It's going to have some limited preemption of state laws so that there is a uniform standard nationwide. And so, we are very excited about this bill because we see it as a civil rights act for the 21st century, because fundamentally, if we want to protect equal opportunity online, if we want to protect all these different types of personal information to prevent them from being used for discriminatory purposes, we need something like HIPAA.
Great. Andrew, Cora, Nadia, any additional thoughts on congressional actions that may be necessary or that you'd support or you have supported? Okay, I guess not. So moving along, I know we generally don't want to take a public position on various legislative proposals, but maybe we can sort of unpack the various different elements that David sort of talked through. So I think we talked about, and it came up in various different conversations throughout the day, and what are the elements? So let's say, aside from the Data Protection Act that David talked about, without kind of naming the legislation, what are the elements? What are the principles that we care that you all would think is very important to have in protecting the appropriate collection, appropriate and ethical use, protecting the data itself and security measures, and also maybe I'd love to get your thoughts on, those particularly sensitive issues, data points like race, ethnicity, language, sexual orientation, and gender identity, which is really important in addressing health equity issues. And how do we balance all that in terms of, I think Cora mentioned earlier, the collection and ethical use, with also making sure that the consumer trust is maintained, built and developed and maintained. So I know that's a lot, but maybe we can go into the various principles so that we're not, backing one legislation or the other. So maybe we'll start with kind of the appropriate ethical collection and use. And also, are there standards out there that you all think would be a good reference point in any kind of a legislative or regulatory proposal?
So I just want to actually point out that my organization, the American College of Physicians, has supported ADPA. But we do, with some caveats, we think it can go farther in some areas. As for the principles that are enshrined in ADPA that we believe in, one of the main ones is privacy by design. And this is the concept where you basically, it's a kind of requiring privacy considerations to be baked in from the beginning rather than being an afterthought, because it becomes difficult to kind of, add these protective measures after a product or service has already been kind of finalized. And so privacy by design, basically, it is a lot of kind of data minimization. As David was saying, the purpose for collection usually has to be specified, and the data collection itself has to be limited and relevant to the stated purposes. And then the use, retention, and disclosure of the data has to be limited to what was consented to, and consent usually has to be obtained either before or at the point of data collection. So these principles basically are, again, consumer centric, and they facilitate patient consumer autonomy. So it's just one of the ones that we appreciate.
And I'll just build upon that too. I mean, we at CDT received various generous funding from the Robert Wood Johnson Foundation, and we worked with our partners at Executives for Health Innovation, EHI, even before HIPAA was released. This is a couple of years ago, to develop a consumer privacy framework for health data. And as I drafted kind of the key elements of this, it is designed to be a framework for industry to look at and enact themselves outside of federal legislation, very much with the purpose of, as we wait for federal comprehensive privacy legislation to happen, this was drafted as, in the interim, here are some best practices that we believe folks can do when it comes to non-HIPAA covered data. And a lot of the elements that David and others have brought up during today's panel are included in the framework we've developed. But one thing we haven't talked specifically about, and you mentioned earlier, Lauren, was, let's start at that kind of inflection point of how are we defining the data to begin with. And that's something we gave a lot of thought to, because, health data, sounds good when you say it. You're like, oh, everybody knows what that is. But, it's actually, we spent hours and hours and days debating how we were going to define health data. And what we did with the framework is we embraced kind of a purpose and use-based approach, right? To say, if you're using data points to make conclusions, predictions, or insights into a person's physical or mental health, we're generally going to treat that as health data. And then the subsequent limitations on use, of sharing, of consumer rights, all that's going to then trigger. If the data is not being used for those purposes, then generally it's going to, be outside of our proposed framework. And that's consistent with, I think, some of the approaches you've seen in federal legislation too. So, right, like a core element to any of these is, how are you actually defining the data set? And when it comes to health data, that can be a pretty broad data set, right? That can be things like geolocation data, right? Because if folks know I'm visiting a health clinic that specializes in a specific type of treatment, it doesn't take much to say or reach the conclusion, oh, Andy's visiting that clinic that only does that one thing. He or somebody very close to him is, has that health condition or is seeking that type of treatment. That also has implications, and one of the earlier panels talked about this too, in a post-Dobbs world too, right? Where that information about reproductive health can now be used in ways that not only potentially implicate individuals seeking reproductive health care, but the providers of that health care too. So defining the data set, defining the appropriate uses, defining the inappropriate uses, ensuring that consumers know, anticipate, and trust how their data will be used. Again, I'm starting to sound like a broken record, but these are all consistent elements that you'll see not only in our framework, in the legislation that's proposed, but in other kind of industry produced and health organization produced privacy frameworks as well.
And I think I'll just echo something that I think all three of my co-panelists have raised. I think when it comes to trust, David, I love what you said about there being, a baseline of consumer protection around data, because requiring that to be something that the consumer does every single time with all of the decisions that they have to make around their data is just not a tenable solution. So a solution that I think puts less weight on that, though certainly consent is important, but an overall solution that I think puts less weight on that and more weight on the idea of stewardship, I think is important to think about.
Great, thank you. I don't know, Nadia, you had weighed in already? Okay. Well, so let me then maybe dig in a little deeper with the few minutes we have. So a couple things. Let's talk about the baseline stewardship, which Cora, I think, and you and David agree on in terms of kind of having line protection of privacy. And then I like to get into the word, I think, Andrew, you mentioned from the framework that you've developed, inappropriate uses, right? The use case or uses that is ethical, appropriate. How is it defined and who gets to define it? So maybe, and I know those are kind of broad questions, but I think to some extent those are the challenges. And I think also Cora and Andrew, you both mentioned the concept about health data, and the definition of that is so broad, right? Because I mean, the way technology is embedded in all these healthcare care coordination, population health, I mean, it's just really very broad, right? So how do we start putting some parameters around that, as maybe going back to what David and Cora said, kind of the baseline of privacy protections, but it has to be defined within a certain context. And what does that context look like? And who gets to decide what is appropriate and what's not? And then also, what is there a role for government? Because clearly we're talking about industry practices, but getting the industry all on board and adoption, sometimes having a government lever is helpful. So would love to get your thoughts on that. So I know that's a lot of questions, but I thought maybe we can go just one layer deeper in what you all the great ideas you all proposed today.
I'll take a first stab at other people, please. Like, I don't want to monopolize this in any sense. So, I'll be the little homer and talk about the policy we wrote and then how it's consistent with, I think, things in ADPA and others as well. But to your question about, what are those limitations? What are the, appropriate versus inappropriate uses of consumer health data? And what we generally settled on, or, this isn't going to surprise folks on this panel and folks listening, is that, you really want to center on, acceptable uses include things that, are related to what the consumer has directly asked for, right? If I have a step counter app and I want to count my steps, but also monitor my heart rate while I do it, I expect the app will, collect and, present that data to me. What I don't necessarily anticipate or want is that app to then also repackage that, sell it to a data broker, or sell it to just, a third-party advertiser to then, either use to target ads to me or to, further inform a profile maintained by any number of entities that do that, like data brokers. So, we really, generally speaking, drew a line between those, direct uses that consumers want versus those secondary and tertiary uses that, especially for sensitive data sets like health data, we just felt were, not appropriate uses of the data.
Great. Any others? Cora, Nadia, David?
So I absolutely agree with Andrew on that point. I'll just make one a different point quickly, and that's that I feel like, to your question about is there a role for government? I think there is. I think there is a role for legislation. I think You have seen a lot of activity due to some of the gaps we have with respect to codes of conduct, with respect to best practices. And I think that is all great work. I think it becomes even more effective when you have an accountability mechanism. And I think that is what is often hard when it comes to best practices. So I think in my view, there is certainly a role for government here.
Yeah, and if I could just add on to that, to talk about the role of government here, government setting rules here is good for business. Not just because you can have, one set of rules nationwide, but also because we need consumer trust in the ecosystem. How many of us have said, I'm not going to put my info into this app or this website. I'm not going to use this thing. I'm not going to use that thing. I don't know about this. And now think to yourself, like, how often do you get squeamish about buying a random new product in the grocery store? We trust that the food we eat is safe because the FDA says so, and it's been that way for 100 years. I have no qualms about buying some new brand in the grocery store that I've never seen before. And that's what we need in the tech space. We need to have baseline protections so that people can trust that new startup that is going to treat their data fairly and safely. And so, building and unlocking that consumer trust is crucial to promoting competition and innovation. And that's a role that really only the government can play. You need something like what the FDA does, what the FTC does. That is why we have these types of agencies.
Great. Nadia, Danny? No. Okay. Well, I know we're already over time, so I want to thank this panel, distinguished panelists, and for our robust discussion today about what the non-HIPAA covered health data environment looks like, and what are the gaps, and what are some sort of needed proposals, reframing in terms of how we go forward from here in protecting consumer health data. So I want to thank the panelists again, and the participants today, and also thank you all. Thanks for this opportunity, Kristen, and I'll turn it over back to you.
Great. Thank you all for that very thorough and interesting conversation. I think there's a lot to be taken away from the remarks that you all shared today. So this is the end of our formal agenda. I did want to spend just a few months closing. Thank you for all of you that hung in there with us for the whole 3 hours. As you see on the screen here, and as I mentioned at the outset, we are on Twitter and LinkedIn, so please connect with us there and follow along with the conversation that happened throughout the event today. The recording will be posted on the website, as will any additional materials. So please check there. If you have any questions, you can always reach out to us. I did want to flag, as is our custom here at the Health IT Leadership Roundtable, we will be following today's event with a white paper summarizing the key points of the discussion today, along with consensus-based recommendations. So as I said at the outset, the whole purpose behind the Health IT Leadership Roundtable is to bring stakeholders together from all across the healthcare system from different perspectives, and to find areas of commonality where we can all work together. So the white paper will really summarize, I think, some of the discussion here today, but also areas where, sort of low-hanging fruit areas where we can all come together, where there is consensus that something needs to be done as an action item by either the administration, Congress, or the private sector. So I think the timing for that will end up being early January, but again, please watch our LinkedIn page and our Twitter accounts for update on that. We don't want it to get lost over the holiday season, which is rapidly approaching. So again, I think that will be early January, but we will keep you all posted via our email lists and also social media accounts. So thank you for joining us today. If you have any questions, you see my email up on the screen. Please feel free to reach out. And we look forward to being in touch with everyone soon on future Health IT Leadership Roundtable activities and follow up from this one. So thank you for participating. Thank you to all of our host committee members, our panelists, and all of our attendees for your great questions here today. So thank you and have a great Wednesday.